You did a great job.
Okay, thanks. All right, so I'm gonna share my screen with you guys. Give me 1 second.
Is there certain scores that we should be getting, like average or like maybe half right? Like what were you
Yeah,
compare it for the exam?
so it depends, like, cause like last year, it, I mean, it really depends on like how hard the TAs make the questions, because sometimes the average can be literally like a 50%, and sometimes the average can be like an 80% or something. It really depends on how hard the TAs are making the questions. But I mean, towards exam times, you would usually get like all your questions right for the exam that was coming up, and I would get like none right on the questions that like the answers, or for the exams that were coming up later on. Like for example, like we would have like a TA's quiz and we'd have anatomy that Friday, and you'd like ace the anatomy part, but then you'd have to get like, I would get like a 0 on like the immuno, because I was like, wait, I haven't even studied the immuno. So really it depends how much you're like putting into class. Obviously you want to put equal work into all your classes, but during exam times it gets a little time consuming and crunch time. So it really depends on the exam scores. I wouldn't be too stressed about being like, oh, I got like a 50 or I got a 60. Just look at what you like, why you got it wrong, and if you understand the reason why you got it wrong.
Anatomy?
What?
No. Are you sure? Yeah,
Somebody's mic's on. Somebody's mic's on.
Just a high-level question for you, Justin. Based off of what you guys had last year, what did the first semester professors taught the most or tested the most difficult?
So you're saying which class was the hardest is what you're asking, right?
Yeah, just curious.
Yeah, okay. So last year, I would just say anatomy was definitely, I mean, I think anatomy was the toughest course for me, and most of the people I studied with. Anatomy was definitely the toughest course. Other than that, I think genetics is pretty hard. I mean, they're all decently hard, but I feel like anatomy specifically, because Muffley likes to test on stuff he says, not only that's what's on the slides. So that's what makes it a little bit more difficult, because he's more prone to doing that. Other professors do that sometimes, but Muffley is really known for just testing stuff that he just talks about. So his exams were a little bit, I would say, more difficult. So that's why I'm trying to prep you guys as much as I can. So whenever he says something that I think that's important, I would like write it down and make sure you guys know it.
Based off of the questions that you created for us, like, would you say they're more representative of like the easy, medium, or hard type of questions that Muffley would ask?
So I would say that like more so the medium. Some of them were hard. Like for example, like the boxing question that I wrote, I feel like that was a decently hard question. I could have made the trapezius question a little bit tougher. The one where it was which one of these elevate and adducts the scapula. I could have put other choices like the levator scapulae, which is actually innervated by the dorsal scapular nerve, but I just made it a little bit like medium wise. It depends. Like I wanted to feel out how the first quiz was going to be, and then we're just going to roll from there. So I'll make adjustments as needed to make sure you guys are as prepared as possible for this exam, because I don't want to make the quizzes obviously too easy, and then you get to the exam and it's like, whoa, like, you know what I mean? But I don't want to make the quizzes like super hard and you're just like, whoa. So I got to see where exactly is that line. So I'm just testing the waters right now, but I feel like the exam questions for this quiz were definitely relative to some of the questions that Muffley would definitely be asking. So yes, I think it would be along the lines of that. Okay, let me just pull up the chat on my phone right now, and then we'll get started. Give me 1 second as I pull up, hold on. Okay, could everybody see my screen?
Yeah.
And the pointer as well.
Okay, perfect. Yeah, gotta make sure that lays out. All right, so I'm gonna go through the shoulder lecture and then the axillary region. So you'll notice like I added a few slides in the shoulder region as well as the axillary region in the beginning, so you guys can really understand the arterial supply coming from the subclavian artery as well as the axillary artery before we dig like really deep into the lecture material. So I wanted to make sure you guys got like a good overview, because seeing all these words and these random names like dorsal scapular, superior thoracic artery, like all these things probably sound foreign. So I wanted to throw in a couple slides in the beginning, which you'll see soon in this lecture, as well as the next lecture, about giving you like the general overview and like some good mnemonics that I used last year that really helped me remember the branches off the subclavian artery as well as the axillary artery, because there's bunches of arteries as well as the brachial plexus that you're gonna have to learn. So I want to make sure it's as easy as possible and as digestible as well. So we'll get right to it. Okay, so for the pectoral girdle, so basically that's going to be anything that connects the appendicular skeleton to the axial skeleton, right? But specifically the pectoral girdle, I'm talking about the shoulder area, right? So we know that the ribs, which is going to be part of the axial skeleton, for example, is going to be connected to the clavicle, which is part of the appendicular skeleton, right? The clavicle is then going to be attached to the shoulder region, which we'll call this entire region right here, the pectoral girdle, right? So technically this would be connecting, for example, like the limbs and the clavicles into the axial skeleton, which would be like the ribs as well as the vertebral column, right? So we'll talk about the brachial plexus and we'll talk about branches of the axillary artery as well as we go through this. So this is the first thing I wanted to talk about on the slide. So the next coming slides I'm going to have are going to be slides that are on my PowerPoint, but feel free to take notes right now. Tell me to slow down if you need to, because I want to make sure you guys really understand this material before we dig deep into the slides. So I used a mnemonic that I feel like helped a lot for learning the subclavian artery. So specifically, these are going to be the branches of the subclavian artery relevant to this lecture. So the mnemonic I used was vitamin C and D. So vitamin C and D are going to be the relevant branches of the subclavian artery. There are other branches of the subclavian artery, but we won't need to know that specifically for this class. Dr. Muffley didn't touch too much upon it. So we'll focus on vitamin C and D, or Vit C and D. That's the best way to obviously spell it out. So they're each going to stand for a certain artery going from proximal to distal. So proximal meaning from the closer to like your shoulder region. Yeah, so basically closer to your shoulder region, right? And then distal going down your limbs, right? So you're going to have the vertebral artery, which would be first. Remember, anything I'm going to put in purple, like a little box in purple, it's going to be like kind of like a throwback tip. So this is going to be a throwback tip. You'll have the vertebral artery, which is going to pass through the transverse foramen of the cervical vertebrae and the suboccipital triangle. Remember when we talked about this in the back lecture, I inputted the two slides right here. So I like to like tie in certain things of stuff that we talked about before. So you guys, one, don't forget it. And two, you understand like as we go on, things build on each other. So I want you to remember the stuff that we talked about before. So the basics can build on into more complex things later on. So this would be the vertebral artery. The next one that we're going to have is the internal thoracic artery. I wouldn't say what you would need to know what the internal thoracic artery supplies. I mean, it supplies some of the intercostals. It goes down the sternum. But the most important thing about knowing about the internal thoracic artery is that it's just a branch off the subclavian artery. I think that should be suffice. The thyrocervical trunk is going to be super, super important. Like this is like key. Like, especially right here, I put a ginormous star because these two branches are not like in the mnemonic, but you have to know them though. So for example, you have the thyrocervical trunk is going to give off the suprascapular artery as well as the transverse cervical artery. The transverse cervical artery is going to supply the trapezius, which is super important. And we're also going to have the suprascapular artery. The suprascapular artery is going to supply the supraspinatus as well as the infraspinatus. So again, like we said, this is going to be vitamin C and D, but remember this T is going to stand for thyrocervical trunk. And you have to remember that the thyrocervical trunk is going to have the suprascapular artery coming off of it, as well as the transverse cervical artery. The C is going to stand for costal cervical trunk, which, I mean, all you need to know is that the costal cervical trunk is going to come off the subclavian artery. Its branches, you won't need to worry about too much. He doesn't talk about it. And then you have lastly would be D, would be the dorsal scapular artery. The dorsal scapular artery is going to supply the trapezius, right? The trapezius as well as the rhomboids major, minor, and the levator scapulae. So it's important for us to realize this is going to be the first branches coming off the subclavian artery, right? So remember, it's like your heart is like, let's just say you have your heart, and then you have your aorta, right? Your aorta, which is like the largest artery coming out of your heart. Aorta is eventually going to branch off into some carotids, and then eventually you're going to have the subclavian artery, right? the subclavian artery is what we're talking about. This is going to be the first part. Subclavian artery is then going to turn into the axillary artery. Axillary artery is then going to turn into the brachial artery. So we'll go through that throughout the lecture. But remember, again, vitamin C and D, vertebral artery, internal thoracic artery, thyrocervical trunk, which is going to have 2 branches. You have to remember these branches. These are super, super important. Remember, they're coming off the T, which would be thyrocervical trunk. You have costal cervical trunk as well as dorsal scapular artery. So feel free to make up the mnemonic you feel like helps you the most, but I feel like I'm going to use this throughout the PowerPoint because it's pretty catchy and it helped me a lot last year. So we'll be using this one. So
quick question. Where did you say the suprascapular artery and the transverse cervical artery, where did they go to?
Yeah, so I'll show you on this slide because it's a little bit better. So the suprascapular artery is going to supply the supraspinatus and the infraspinatus. So the way I like to remember that is that suprascapular means it's going above the scapula, right? So what muscle is going to be above the scapula? The supraspinatus, right? It's also going to supply the infraspinatus as well. So that's important to know as well. But just to get you going in your thinking, remember suprascapular artery means going above the scapula. So to think it's going to supply the supraspinatus as well as the infraspinatus muscle. For the transverse cervical artery, that's actually going to supply the trapezius which I actually put right here because I put like a little throwback tip because remember that the dorsal scapular artery as well as the transverse cervical artery are going to supply the trapezius. So I put the slide that we talked about in the back lecture. I put it right here just for your reference so you guys can realize that yes, we're talking about these arteries, but we've talked about them before, but now we're knowing exactly where they come from, right? So it's important to realize these come from the thyrocervical trunk, which come off the subclavian artery. Does that help?
Yes.
Okay, perfect. I'm just trying to make this as clear as possible for you. So like I said, the heart is over here for somewhere around here. Eventually, it's going to turn into the subclavian artery. The reason why it's vitamin C and D, so I inputted a picture to help you visualize it. It's going to go from proximal to distal, so from closer to the midline to distal. First one is the vertebral arteries, so that's going to be the V. That's going to be VIT, so VIT, C, and D. So V would be vertebral arteries. Remember, vertebral arteries are going to go through the transverse foramen of the cervical vertebrae, right? And it's also going to go through the suboccipital triangle. I is going to be the next one. That's going to be internal thoracic, right? Internal thoracic artery. I think just knowing the internal thoracic artery is going to be branching off the subclavian arteries should be suffice. You don't need to know exactly where it's going to supply. It supplies bunches of things. Then you're going to have this T. This T, I want to put like 2 stars or like a square or something like that for you guys to remember that the thyrocervical trunk is going to have 2 branches, 2 very important branches. It's going to have the suprascapular artery. The suprascapular artery, which is going to go above the scapula, it's going to supply the supraspinatus as well as the infraspinatus. And then you're going to have the transverse cervical artery, which is going to supply the trapezius, right? And then the next one you're going to have is going to be C, costal cervical trunk. You can't see it here because it's behind the scalenus anterior. You can see it a little bit better over here. This will be the costal cervical trunk. And then lastly, you'll have the dorsal scapular artery, super important because the dorsal scapular artery is going to supply 4 muscles. The 4 muscles that the dorsal scapular artery is going to supply is going to be trapezius, rhomboids major, rhomboids minor, as well as the levator scapulae. So again, like this is going to be the section is going to go from vitamin C and D, or VIT C and D for you guys to remember that. So again, subclavian artery to axillary artery to brachial artery. So again, which one of these is not a branch off of the subclavian artery? So feel free to put your answer in the chat. Okay. So yes, it is going to be D. Remember, hint, vitamin C and D. But remember, you have to remember that this T is going to stand for thyrocervical trunk. The thyrocervical trunk, which is going to be located right here, is going to give off the suprascapular artery as well as the transverse cervical artery. And it's important for us to realize that the suprascapular artery, again, I like to repeat things so that we get stuck in our heads, is that the suprascapular artery is going to supply the supraspinatus as well as the infraspinatus muscle. And then you're also going to have the transverse cervical artery, which would be located right here, is going to supply the trapezius, right? So again, this is going to be a vitamin C and D vertebral artery. I would be internal thoracic artery. T, remember, is styrocervical trunk. C is costal cervical trunk, so that's right. And D would be dorsal scapular artery. So for the axillary artery, so I went through the subclavian artery. I'll also go through the axillary artery, just because I want to go through these before we start talking about the lecture, because I feel like it's going to give us a better grasp of the material before we hone in on the details. So here's going to be the axillary artery. So remember when Dr. Muffley actually talked about the 3 parts of the axillary artery? It was on it was on multiple of his slides, saying that you have 3 parts of the axillary artery. Of course, it's going to be one continuation, right? Because here's the subclavian artery. That's like the picture from the last slide. I just made it super small to show you all that the subclavian artery, everything that was vitamin C and D happened already over here. And then now you're having the axillary artery, right? Axillary artery, excuse me, is going to have the first part, which is going to be the medial to the pectoralis minor. Excuse me, medial to the pectoralis minor. So imagine the pectoralis minor being right here. I'll have pictures of that shown later on, but the pectoralis minor is going to be right here above both of these arterial supplies. So the first part is going to be medial to that, which is why it's called the superior, superior thoracic artery. The next part will be these two, which would be the thoracoacromial artery, as well as the lateral thoracic artery. These are going to be deep to the pectoralis minor. And then the third part is going to be lateral to the pectoralis minor, which is going to be the subscapular artery, the posterior circumflex humeral artery, as well as the anterior circumflex humeral artery. We'll go through this more. Don't worry. I'm going to make this as clear as possible. I just gave you like a quick little run through. And again, another throwback tip, remember that the subscapular artery is going to give off the circumflex scapular artery, as well as the thoracodorsal artery. So remember that the thoracodorsal artery is going to supply the latissimus dorsi. So I inputted the slide right here just for your reference. This was on the back lecture. So here's another mnemonic that helped me to remember the axillary artery, because these are going to be a lot of branches coming off. So, and you want to remember them from proximal to distal, right? So from closest to the midline and then to farther away from the midline, right? So we talked about our daily dose of vitamin C and D, which is going to be for the subclavian artery, right? That already happened over here. Now we're coming down here, and this is going to be, I guess, if you don't take your daily dose of vitamin C and D, then you're going to screw the lawyer and save a patient. So that's going to be the best mnemonic that I feel like helped me remember the axillary artery. Feel free to make up your own, but I'm going to use this throughout the PowerPoint in order to guide us for this section. So we have, so each letter is going to stand for something, right? So you're going to have the superior thoracic artery. Just knowing that it's going to be just knowing that the superior thoracic artery comes off of the axillary artery should be suffice. Thoracoacromial artery, I put a ginormous star because if you know the thoracoacromial artery comes off the axillary and you know it's 4 branches, which would be clavicular, deltoid, pectoral, acromial, pectoral and acromial, then you would know like the arterial supply for 3 muscles already, because the deltoid muscle is supplied by the deltoid branch of the thoracoacromial artery. The pectoralis minor and the pectoralis major are supplied by the pectoral branch or the thoracoacromial artery, right? So if you know these branches of the thoracoacromial artery, it's definitely going to help you a lot on the arterial supplies for the rest. The next is going to be L for lawyer, right? So screw the lawyer. So L is going to be lateral thoracic artery. This is another super important artery because remember, the lateral thoracic artery is going to supply the serratus anterior, right? Which is located right here. This is the serratus anterior, this like serrated muscle. Then you have subscapular artery. So subscapular artery is important because the way I remember subscapular artery, which is going to be for stave, so S for subscapular is, okay, so this one's going to go under the scapula, right? So I'm thinking, okay, if it's subscapular artery, this has to be further down the line. So it has to be like along the lines, further down the line of the mnemonic, right? So it's not going to be the first S, it's going to be the second S, because I'm thinking, okay, subscapular artery, in order to get under the scapula, you got to be further down the line or further distal of the axillary artery, right? So the subscapular artery will actually be located right here. And the way I remember the branches off the subscapular artery is that first you have to go under the scapula and then you have to wrap around. So I think when you see circumflex, you think like wrap around. So first I'm like, okay, you have the subscapular artery. First you must go under the scapula, then you must go around. So the subscapular artery is going to get off the scapular circumflex artery, right? Circumflex means wrap around. So that's the way I think about it. First you go under, which would be subscapular artery, then you wrap around, which would be circumflex scapular artery. You're also going to have thoracodorsal artery, which is going to supply the latissimus dorsi. This is super important. And the next two would be A and P, which would be a patient, and that would be anterior circumflex humeral and posterior circumflex humeral. So here are the branches that Dr. Muffley was talking about when he said, oh, okay, here's the first, second, and third parts of the axillary artery. This will be the first, second, and third, right? This is literally going to be located right here. So I inputted an image from Complete Anatomy that I found, and I wanted to show you all what he was talking about based on the anatomical landmark. So I left the pectoralis major, I left the pectoralis minor here so you can realize what he was talking about with the certain parts of the axillary artery. So this would be the first part, right? Medial. Anything that's medial to the pectoralis minor, this is the pectoralis minor, this would be medial. This is going to be the first part, and it's only going to contain one branch, which is the superior thoracic artery, which is highlighted in purple, right? So this highlighted one is going to be the superior thoracic artery. And then if you remember the mnemonic, you should be able to name every single branch coming down from here. So I only highlighted the superior thoracic artery so that can be your basis of the start, right? Because remember, S, it'll screw the lawyer, save a patient. The S is going to be superior thoracic artery. So the next one, if I remember, okay, so the next branch has to be beneath, because he said the second part, the next branch is going to be beneath the pectoralis minor, which is located right here, right? This is the pectoralis minor. Beneath that is going to be, okay, save the lawyer. So this is going to be the lawyer. It's going to be thoracoacromial trunk, as well as lateral thoracic artery, right? So thoracoacromial trunk is going to have its 4 branches right here. And you're going to have lateral thoracic artery, which is going to be located right here, supplying the serratus anterior. Remember, these 2 branches are going to be beneath or deep to the pectoralis minor, which is why they're the second part right here. The third part is going to contain 3 branches, which is going to be lateral to the pectoralis minor. This is the pectoralis minor, and this is lateral. You see subscapular artery. Remember, when I hear subscapular artery, I think, okay, first you must go under, then you must go around. So you have to go under the scapula, so subscapular artery, and then you have scapular circumflex artery. So scapular circumflex is going to branch off of that. But also remember, you're going to have thoracodorsal artery coming straight down to supply the latissimus dorsi, which is right here. This is the latissimus dorsi. And then lastly, you're going to have anterior and posterior circumflex humeral. So this will be anterior, and this will be posterior circumflex humeral. This is super important, posterior circumflex humeral. We'll talk about this a lot because it's going to go through the quadrangular space along with the axillary nerve. So all of these are part of the axillary artery except which? Okay, I'll give you a few more seconds. All right. So yes, it is going to be G, none of the above. I listed these basically as like a study slide for you all to remember that these are all going to be a part of the axillary artery. This is literally the mnemonic going from proximal, which would be here, to distal, right? So again, screw the lower save a patient. Screw would be superior thoracic artery. T would be thoracoacromial artery. Lower, so L would be lateral thoracic artery. This is going to be supplying the serratus anterior. Next is going to be save, so this is going to be subscapular artery. So remember, first you must go under, and then you must go around. So that makes me remember subscapular artery is going to give circumflex scapular artery as well as thoracodorsal artery. Next, you'll have A and P, which would be anterior and posterior circumflex humeral artery. Great job, you all. Really good. So here's the slide that he started with. So you're going to have, so this is going to make a little bit more sense because we talked about this in the beginning, right? So we have 1 and 2, which are going to be coming off the subclavian artery. So it's important to note these 2 come off the subclavian artery. How do we know that? Well, we go back to our daily dose of vitamin C and D, right? Or vit C and D. So dorsal scapular, we're like, okay, that's going to be that's literally vitamin D, right? Obviously it's not, but yeah, vitamin D. So this is going to be the D. That's going to be dorsal scapular, right? So we know dorsal scapular is going to come off subclavian. But remember, this T in vitamin C and D, or vit C and D, is going to be super important, right? Because this T is going to be the thyrocervical trunk. The thyrocervical trunk is going to give off the suprascapular artery, which is located right here, suprascapular, as well as the transverse cervical artery. So remember that. So they put suprascapular here, but you still have to know that this is going to be coming off the subclavian artery. Even though it's technically not in the vitamin C and D, it's coming off a branch of the thyrocervical trunk, which I would like star this T like twice just to remember that you have to know these branches. So subscapular, the rest of these are going to be off the axillary artery. If we remember our mnemonic again, we have screw the lawyer, save a patient. This is going to be the, actually I'll go in order. So we have L would be lawyer, so you have L would be lateral thoracic. Next you'll have save, which should be subscapular. And you also have scapular circumflex coming off of that. And then the P would be the posterior humeral circumflex. So if I looked at this slide and you just basically used your mnemonic, right? You wouldn't even have to like, I mean, you could, yeah, you would just have to use your mnemonic and you'll be able to label every single branch here. So for example, if I tell myself, okay, I want to label all the branches of the subclavian artery, what do I have to remember? Okay, I have to remember vitamin C and D. So here's vertebral artery, that's V, right? Here's I, which is internal thoracic artery, right? Now I'm at T. Remember, T is super important because that's thyrocervical trunk. This is going to be thyrocervical trunk. Then again, remember, I want to star like T like twice. It's really important for us to remember that coming off the thyrocervical trunk is going to be the suprascapular artery, which is located right here, as well as the transverse cervical artery. After that, I'm like, okay, back to my mnemonic, costal cervical trunk. You can't see it here because this muscle is hiding it. And then you're going to have D. This is going to be dorsal scapular. Okay, see, I just named the entire branches of the subclavian artery because I remember this mnemonic, right? So hopefully that mnemonic will help. The next one, I'm like, okay, let me go down the axillary artery using my mnemonic. So I have superior, I got to have screw the lawyer, save a patient. So screw, superior thoracic. This has to be superior thoracic artery. Then I have the, which is going to be T. Look, this is thoracoacromial with its 4 branches, right here, 4 branches. Remember, pectoral, acromial, clavicular, as well as deltoid branch, right? Those are going to be the branches of the thoracoacromial artery. The next, we have lawyer. So screw the lawyer. This is lateral thoracic, right? Lateral thoracic, which is going to be coming straight down and supplying the serratus anterior. So screw the lawyer, save. So this has to be subscapular, right? Subscapular artery. First, you must go under, then you must go around. That's what I remember. So subscapular artery, and then you have scapular circumflex artery coming around the scapula. Over here, but don't forget about this branch. This is also going to be thoracodorsal artery supplying the latissimus dorsi. And I have a patient. So this is going to be anterior circumflex humeral, and this is going to be posterior circumflex humeral coming around the posterior side. So again, you see, I just used my mnemonic. I didn't have to look at anything because if I use the mnemonic and I remember what they stand for, you should be able to label anything on any slide. So that's that. So here's the artery supplying the shoulder region. So he gave you a few cadaver pictures. I tried to put in as many questions as possible throughout the PowerPoints regarding cadaver pictures, so you guys can really understand that he's going to obviously test you not only on knowing where knowing what the artery and the nerve is going to supply, but where it's actually located as well, because he specifically stated that he can put pictures on the exam. So again, these are going to be the branches of the thyrocervical off the subclavian. If we remember our daily dose of vitamin C and D, we know that the transverse cervical artery as well as the suprascapular artery are coming off of the thyrocervical trunk. Remember that. Those are the 2 things that are super important for that. This is going to be the suprascapular artery, and this will be the transverse cervical artery. You don't need to know this branch. This one's the inferior higher, but you don't need to know that. So these are the 2 branches that are super important, right? So this is going to be coming off the subclavian artery. So this is going to be the subclavian artery, this big white thing right here. And it's going to eventually turn into the axillary artery, right? Over here, we have the branches of the axillary artery. So remember, if we remember our mnemonic, screw the lawyer, save a patient. And I'm over here and they say, okay, this is going to be thoracoacromial artery, which is located right here. Then I know the thing that's going to be after the is going to be lawyer. So this has to be lateral thoracic, right? Lateral thoracic, which is going to be supplying the serratus anterior, right? And then over here is going to be another one, another cadaver picture, which is going to have, so we have save a patient, which is going to be later on, right? Which is going to be subscapular artery right here, subscapular artery, which is going to, it's not going to be shown, but remember, first you must go under because it's sub. First you must go under the scapula and then you must wrap around. So subscapular artery is going to branch off into the circumflex scapular artery as well as the thoracodorsal artery. And then you're going to have the anterior and posterior circumflex humeral. The posterior circumflex humeral is a little bit like thicker than the anterior circumflex humeral, so that's how you can tell the difference between those. But I don't know. I don't think he'll test you between which one's anterior and which one's posterior because they're pretty close. And that's going to be those. Okay. Yeah. If anybody has any questions, please feel free to let me know because I know the cadaver pictures make it a little bit more difficult because it's not the picture perfect image of everything. So feel free to cut me off whenever you need. All right. So dorsal scapular artery supplies which muscles or muscles? I'll give you all a few seconds. I know this is a tricky one. All right. So what artery, the dorsoscapular artery is going to supply which muscle or muscles? It is actually going to be F, all of the above. So it's important for us to realize, remember, the dorsoscapular artery is going to come off of the subclavian artery, right? Because that's part of our daily dose of vitamin C and D, right? Because the D is going to be for dorsoscapular artery. Dorsoscapular artery is going to supply, if we remember from our back lecture, it's going to supply the rhomboids major and minor, the levator scapulae, as well as the trapezius. Remember, the trapezius is going to be supplied by the dorsoscapular artery as well as the transverse cervical artery. So that's super important to know that. That's super, super important. So that's why it's included in all of these. So yes, good job, good job. So over here, so we talked a little bit about the superior transverse scapular ligament, or the suprascapular notch, which is located right here. The most important thing I feel like you need to know is that the suprascapular artery is going to come above the suprascapular notch, while the suprascapular nerve is going to go below. So think artery above, so then and the nerve will be below, right? So the suprascapular artery will be above, the suprascapular nerve will be below, right? I mean, you can't see it, but it would be below this ligament right here. So that's why I put these notes right here. And again, if we remember our vitamin C and D, then we'll remember that the dorsoscapular as well as the suprascapular are going to come off the subclavian artery, right? Because for thyrocervical trunk, that's going to give off the suprascapular artery as well as the transverse cervical artery. I'm going to keep repeating that so we remember that this T has two branches that are super important. So it's going to have suprascapular artery, which is located right here. And then you're going to have as well as dorsoscapular artery, right? So the next one is going to be the scapular circumflex as well as the posterior humeral circumflex. This artery is super high yield, the posterior humeral circumflex. I would know this because the posterior humeral circumflex as well as the axillary nerve are going to come out of the quadrangular space, which is located right here. We'll talk about this later throughout the lecture, but remember, this is the posterior circumflex humeral, or posterior humeral circumflex, because it's going to be coming out of the quadrangular space, right? This is this quadrangular space, this like a square thing or a rectangle thing, right? But the axillary artery is coming with it as well. So that's going to be super important. And these two come off the axillary artery as well, because remember, this is going to be the S for save stands for subscapular artery. But if you remember, first you must go under, then you go around. So subscapular artery is going to give off the circumflex, the scapular circumflex or circumflex scapula. Remember, circumflex, think wrap around, right? So wraps around the scapula. And then you have the posterior humeral circumflex, which is going to stand for the P, right? That's going to be coming out of the quadrangular space. So that's super important, right? So again, I noted these slides right here so you guys to help you all out. Remember, this is the slides that we talked about in the beginning. Remember, you're going to have your daily dose of vitamin C and D right here. And you're also going to have the screw the lawyer, save the patient for axillary arteries. So I noted these slides right here just to help you out. They give you some good mnemonics to remember the branches off of these arteries. So again, we'll talk a little bit about, we're going to talk a lot, obviously, about the shoulder and the brachial plexus. So I guess we'll just get a little bit right into it after this question. So what is the name of the structure that the blue arrow is pointing to? So I like to throw in these comprehension check questions, especially with cadavers. So I know it's hard to cover them up, so I try to cover them up for you all, like to cover the names so that you can see what kind of material is testable and how it would look. So which nerve, I'm sorry, not nerve. What is going to be the blue structure, or what is going to be the structure that the blue arrow is pointing to? All right, so yes, the answer is going to be B, thyrocervical trunk. Can anybody tell me a branch coming off of the thyrocervical trunk? You could just like yell it out. Like for example, what would this or this branch be? You don't have to say which one's which, but like what is going to be a branch of the thyrocervical trunk? Can anybody tell me?
Suprascapular artery.
Yes, yes. So they're good. This would be suprascapular artery, and this would be transverse cervical artery. So yes. So again, like I want to hone in on this. It's important to know that the T in vitamins C and D, or vitamin C and D, is going to have the suprascapular artery, which is located right here, and the transverse cervical artery. So yes, thank you for that. And then we have dorsal scapular artery. Remember, that's going to supply 4 muscles. Remember that 4 muscles to the dorsal scapular artery: trapezius, as well as the rhomboids, which are the major and minor, and then the levator scapulae. The thoracoacromial trunk, which has 4 branches, we'll talk about later, and then axillary artery. This is going to be the axillary artery coming down here. This is technically subclavian because this is our vitamin C and D, right? So we're going to talk more about the shoulder. So we'll start with the pectoralis major, right? So I like to start things that are going to be super high yield. So for example, the lateral ridge of the intertubercular groove. Remember, the pectoralis major is going to attach to the lateral lip of the intertubercular groove, also known as the bicipital groove. Remember, what's going to attach to the medial lip of the bicipital groove? Can anybody tell me? Medial lip.
Latissimus dorsi.
Yeah. Perfect. Yes, the latissimus dorsi. So yes, the latissimus dorsi is going to be on the medial lip, and the pectoralis major is going to be on the lateral lip. So again, remember, don't get those two confused. And then you have arteries. So now this is when our early work pays.
You're muted, Justin.
We can't hear you.
Yeah, I don't know how that happened. Can you hear me now?
Yeah, you're good.
Okay, perfect. Okay, so we have the pectoral branches, right? So that's coming off of the thoracoacromial artery. Super important. So now that we know that these branches come out the thoracoacromial artery, we know where they're going to supply, because pectoral branch, literally the pectoralis major as well as the pectoralis minor. And super, super important, this is definitely high yield. Remember that the medial and lateral pectoral nerves are going to supply the pectoralis major, because remember, the lateral pectoral nerve and the medial pectoral nerve are going to supply the pectoralis major. When we talk about the pectoralis minor, that's only going to be supplied by the medial pectoral nerve, which is why I say this is super high yield. So remember, the pectoralis major has the medial and lateral. The pectoralis minor is only going to have the medial. And again, if we know these attachments, we should know exactly what the pectoralis major is going to do. It's on the medial third of the clavicle, which will be located right here. The costal cartilages of ribs 2 to 6. And it's going to be, remember, super important, the lateral ridge of the intertubercular groove. So again, I put a little throwback here for us to remember. Latissimus dorsi attaches to the medial lip of the intertubercular groove. So I inputted the slide right there. Remember, pectoralis major attaches to the lateral lip of the intertubercular groove, which is located right here. Right? This is going to be the lateral lip, and this will be the medial lip on this side. So remember, bicipital groove and intertubercular groove can be used interchangeably. So yeah, this is just going to be a repeated slide. But again, I'm going to emphasize pectoralis major, remember, is going to be on the lateral lip. It's located right here. Latissimus dorsi, which is right here, is going to be located on the medial lip of the intertubercular groove. And then, yes, and then other than that, remember that the pectoralis major is going to be supplied by the medial and lateral pectoral nerves. So medial and lateral. The pectoralis minor is only going to be the medial. Okay, so here I am again repeating myself. Remember, medial and lateral pectoral nerves for the pectoralis major. So I wrote a note here, medial and lateral. For pectoralis minor, it is only going to be medial. So when I'm talking about these cords, when we talk about the brachial plexus, I'm going to explain exactly what these cords mean and what these branches and divisions are going to be composed of for the brachial plexus. But essentially, what the lateral cord means is that it's literally going to be lateral to the axillary artery. So here's the axillary artery. This cord, which comes out the brachial plexus, is called the lateral cord because it's literally lateral to the axillary artery. This cord is posterior to the axillary artery, so it's called the posterior cord. This is going to be called the medial cord because it's legitimately medial to the axillary artery. So everything in regards to the cords are going to be in relation to the axillary artery. So again, here's a little overview of the brachial plexus. This is going to be like your picture perfect view, right? Obviously, it's not going to look as good in the cadavers, but this is going to be what we use to base off all the cadaver pictures, because it's hard to point out what's going to be what on these cadaver pictures without understanding completely what the brachial plexus consists of, right? So this would be the lateral pectoral nerve, which is what we talked about, which is supplying the pectoralis major. Remember, this is going to be the only branch that comes out the lateral cord. Then we have the posterior cord as well as the medial cord. Remember, the medial pectoral nerve is going to come off the medial cord, and it's going to supply the pectoralis major as well as the pectoralis minor. Super, super important. So which muscle attaches to a portion of the bicipital groove? Oh, and then I'm going to be posting this, PowerPoint after this lecture or after the TA session. So feel free to like download it, ask me any questions regarding that. Okay, so the answer is going to be D. Yes, it's going to be D. It's going to be the pectoralis major, which attaches to the lateral lip of the bicipital groove, and you're going to have the latissimus dorsi, which attaches to the medial lip of the bicipital groove. Remember, does anybody remember where the pectoralis major attaches to? Minor, excuse me. Wow. Anybody remember where the pectoralis minor attaches to?
The coracoid process?
Yes, perfect. Yeah, so we'll talk about that. I mean, actually, I think I put a question on the quiz on that. Yeah, so I put a question on the quiz on that regarding what attaches to the coracoid process. So you can use those answers as a list of muscles that attach to the coracoid process. So yes, this will attach to the coracoid process. All right, so the deltoid muscle, I skipped this. So we're going to talk about the deltoid muscle a little bit. So he talked a lot about the deltopectoral groove. I wasn't sure how important it was, but I put it in here just in case. He talked about the deltopectoral groove, which is just going to be this little groove right here running between the deltoid muscle, which would be located right here, and the pectoralis major muscle. And remember, what goes through that is going to be the cephalic vein. So if he does ask about it, that's why I put it in there just in case. Remember that the cephalic vein is going to run through the deltopectoral groove. And you know this is a vein because when you look at cadaver pictures, when you start looking at like more and more, you'll be able to see that this is a cadaver, or this is going to be a vein. Is because it's going to be purple, right? When it's like purplish, like you see this little purple color located right here, that's when I am able to see and like identify that, okay, this is going to be a vein. Arteries and nerves are going to look a little bit different, but when you see this purple color, it's safe to assume that that's going to be a vein. So again, if he points at this, last thing you want to do is he points at this in the exam and you're like, oh, that's subclavian artery. No, this is going to be subclavian vein, right? So again, because it's going to have like this purplish thing on there. So you don't want to get confused between a structure because it's the vein rather than the arterial supply, right?
Justin, just a random question for my curiosity. Is there any actual difference in the composition of the tissues that makes it have a different color?
So with venous supply, what's interesting about the difference between venous structures as well as arterial structures is that arterial structures have lots of musculature surrounding the arteries. So for example, the axillary artery has lots of muscle, like smooth muscle surrounding the arterial supply. So when you have a cadaver, the artery remains its structure. So it keeps its round shape because of the muscles that it had. The subclavian, like veins in general, are super elastic in the human body. They have very little muscle, and you can imagine when there's no more blood left in cadavers that the vein is going to like kind of like flatten out, and some of the blood is going to stay there. And what's interesting is I remember that like almost like a majority of our blood is just sitting in our veins, like almost like, I don't know, like 70 or 80% of our blood is in our veins. So this is why you see like this purplish color in the vein, and you see it more as like a flat structure because it's flattening out because it had no structure in comparison to the artery. Does that make sense?
Yes.
Yeah.
Thank you.
Okay, gotcha. You'll learn a lot about that in histology next semester. So when I start talking about things in the microscopic level, so that's a really good question. Okay, so you're going to have the deltoid. So this is going to be, you have the deltoid tuberosity is going to be the attachment for the deltoid. I mean, it makes sense, right? It has deltoid in its name. Remember, deltoid tuberosity is going to be located on the humerus, right? So it's going to be located on the humerus, which would be, you can't see it obviously, but it'll be over here. Then you're going to have the arterial supply is going to be the deltoid branch of the thoracoacromial artery. Remember, screw the lawyer, save a patient. That T is going to stand for thoracoacromial artery, which has 4 branches, right? So that T is going to have 4 branches. And it's going to have clavicular, it's going to have acromial, it's going to have pectoral, which is going to supply the pectoralis major and minor, and you have the deltoid branch, which supplies the deltoid, right? Innervation, axillary nerve, super high yield. Remember that the deltoid muscle is going to be supplied by the axillary nerve. Super, super important. So I would label like, okay, so actually the only 2 muscles that we talk about that are going to be supplied by the axillary nerve is going to be the deltoid major, the deltoid muscle, as well as the teres major. So feel free to write that down. I like to categorize nerve supplies in order to the muscles that they supply to sometimes. So for example, axillary nerve, the only muscles that we'll be talking about that the axillary nerve supplies will be the deltoid muscle as well as the teres major. So that's going to be, oh, no, excuse me. Wow, teres minor. Wow, yeah, excuse me, teres minor. So it's going to be supplying the deltoid muscle. I was like, wait, that's not clicking. Yeah, it's going to be supplying the deltoid muscle as well as the teres minor. Yeah, correct me. That's going to be the teres minor. Okay.
Can you back up? Can you back up after deltoid tuberosity, please?
Right here?
Yes, covering the arteries.
Yeah, right here?
Yes.
Okay, you want me to go over it, is what you're saying?
Yes, start
okay.
Arteries again, sorry.
No, I got you. Yeah, no, feel free to tell me to slow down if anything, let me know. Okay, so thoracoacromial artery. So remember, screw the lawyer, save a patient. So it's going to be coming out the axillary artery because that T stands for thoracoacromial trunk. If we remember, thoracoacromial trunk is going to have 4 branches. It's going to be clavicular, acromial, pectoral, and then the deltoid. So the deltoid one is going to be supplying the deltoid muscle. You're also going to have the posterior humeral circumflex artery, which is going to be supplying the deltoid muscle. And that makes sense because when we talk about the quadrangular space later, which is going to be located right here, you can't see it too well, but I'll show you later on. The posterior humeral circumflex, as well as the axillary nerve, go right through that. So it makes sense that the posterior humeral circumflex supplies the deltoid muscle as well. Does that help?
Yes.
Okay, perfect. And again, remember the deltopectoral groove, the cephalic vein runs through that. So here's the deltoid muscle, right? This is going to be the deltoid, and if he puts this on the exam and he points at it, he can ask whichever question he may. Like for example, what's the movement of this muscle? What's the innervation? What would be the arterial supply? So again, like we said, when you question yourselves on these cadavers, don't just be like, oh, that's the deltoid, oh, that's the teres minor, teres major, etc. You should be asking yourselves, okay, what's the innervation? What's the arterial supply? What's the movement? Where does it attach to if it's like an important attachment? So for example, the pectoralis major being on the lateral lip of the bicipital groove. Those are the questions that you should be asking yourself because he can base that off of a single picture, right? That'd be deltoid. So if you sever the medial pectoral nerve, which muscle or muscles are affected? I'll give you a few more seconds. Oh, right. So it will be D. Yes, it's going to be A and C, the pectoralis minor as well as the pectoralis major. Remember, the medial pectoral nerve is going to be supplying the pectoralis minor as well as the pectoralis major. Remember, the lateral pectoral nerve is only going to supply the pectoralis major. This is why I'm going to keep honing in on this so you all don't get confused, because the medial is going to supply both, and the lateral is going to be supplying only the pectoralis major, right? The subclavius, I just threw that in there. Okay, so again, like we said, we talked about the chords earlier. Remember, lateral chord, posterior chord, and medial chord, they're all just going to be in relation to the axillary artery, right? So this is going to be super important. So feel free to write your notes on this slide. I added a slide on the next one, so I'm going to skip to that, which is basically going to be talking exactly about what's on this slide, okay? So we have the quadrangular space, right? So this is going to be the quadrangular space located right here. So I wrote the borders for us right here out. So laterally, you're going to have laterally, you're going to have the long head of the triceps brachii, right? So you see that right here. This is going to be lateral. This is going to be the lateral border, right? The long head of the triceps brachii. The medial border is going to be the shaft of the humerus. The superior border is going to be the teres minor, and then the inferior border is going to be the teres major, right? So it's super important for us to know this quadrangular space, because what goes through this is going to be the axillary nerve as well as the posterior circumflex femoral artery. So again, it's like I wrote a little thing to remember that. Remember, only AP students can pass through the quadrangular space. So when I mean AP, I mean, obviously it's going to be axillary nerve as well as posterior circumflex artery, right? So super important to remember, or posterior circumflex femoral artery, same thing. That's going to be really important to know that's going to be coming out of the quadrangular space. So I would note that, put a huge star that, and I would also note the borders as well. All right. So here's the 3 parts that he put of the continuous structures. So I talked about this earlier in the lecture in the first like 5 or 6 slides when I started breaking up into the vitamin C and D as well as screw the lawyer, save a patient, because I wanted the first to be prepared for this slide and not be thrown at by like a bunch of arteries all at once. So that's why I came up with these. I found these mnemonics for you all to help you out. So it makes it just a little bit easier, right? So we'll start with the subclavian branches, right? So the subclavian branches he wrote are going to have exactly what we have, vitamin C and D, right? So you're gonna have vertebral artery, internal thoracic artery, thyrocervical trunk. Remember, put like 2 stars or a square, whichever helps you remember that the thyrocervical trunk is going to have the suprascapular artery as well as the transverse cervical artery. And again, we're going to come back into the mnemonic. So C is going to stand for costal cervical trunk, and then D is going to stand for dorsal scapular, right? So now we know all the subclavian branches, right? Axillary branches, or we'll talk about based on what he said in these parts, right? So he like divided everything into the first part, second part, and third part. So the first part is going to be medial to the pectoralis minor. The second part is going to be beneath the pectoralis minor. And the third part is going to be lateral to the pectoralis minor. So I inputted this picture again. It's just to remind you all, here's the pectoralis minor, right? Here is the entire, right, starting from here, is the entire axillary artery, right? So he just split it into 3 different sections, right? The first part, which coincidentally is only going to have 1 branch, right? So first part, 1 branch. The second part has 2 branches, and the third part has 3 branches, which helps us out, which helps us to remember it, right? So the first part I highlighted, this is the superior thoracic artery, right? Remember, this is going to be the screw part, so screw, right? The second part is going to be beneath the pectoralis minor. So I inputted the pectoralis minor here, and beneath that will be the thoracoacromial artery, as well as the lateral thoracic artery, right? So that's going to be the lawyer. So screw the lawyer. And the third part is going to have 3 branches, and it's going to be save a patient, right? So save a patient, which is going to be subscapular artery. But remember, when you hear subscapular artery, you got to think, okay, first you must go under, then you must go around. So then that reminds you that it has branches, right? So subscapular artery is going to give off the scapular circumflex artery, and it's also going to give off the thoracodorsal artery over here. And then you have anterior and posterior femoral circumflex. So I hope us like talking about it like earlier on really helped getting things down in regards to this slide. This is just going to be the cadaver picture. Obviously, you can't point on many structures here. He just wanted you to note the subclavian, axillary, as well as brachial artery as they go down, right? So I hope those mnemonics and as well as talking about it a lot early on is going to help us understand these branches.
Justin?
Yeah.
Can you go back real quick? Just to orient myself a little bit, can you point where on the diagram versus the like what corresponding sections of the cadaver actually fall on the diagram, just so I can orient myself a little bit?
Oh, like what here is going to correspond here?
Yeah, like can you point to the subclavian on the cadaver, and then like where it is on the actual diagram of the human?
Yeah, got you. So over here, yeah, got you. This is going to be the subclavian artery, and then the reason why we know that is because this is the thyrocervical trunk, right? Because this is going to be part of our vitamin C and D. You won't be able to see the V or the I because vertebral artery and then the internal thoracic are like you want the muscles covering that up, right? So the V and I are covering that up. So we see the thyrocervical trunk right here. This is going to be suprascapular artery, and this will be transverse cervical. All right. So we can't see costal cervical trunk because it's actually going to be posterior to this muscle. And then dorsal scapular, you just can't see it here as well because the picture is not too well. over here is going to be, as we move down, this is the axillary artery, right? So there's a lot of things covering that, so I won't want to like name branches because obviously you can't see branches here, but I would just note that the axillary artery is going to be here. Brachial artery is not this close. He just labeled it there just to know that like the brachial artery is eventually going to go down. But the axillary, yeah, this is because this is going to be, I believe this is probably going to be the pectoralis minor. So
yeah, I was gonna say, so right under where it says brachial, that's still technically the axillary
that's
artery.
axillary. There's no way that's brachial. Yeah, he just wrote that there just to give you a sequence.
Yeah, that's what I was.
Yeah, so I see how that's a little confusing.
Diagram. Okay.
Yeah, it makes it look so short. Yeah, I know. That's a good question. All right. So this muscle is a part of the quadrangular space and promotes extension of the arm. Which muscle is it? I'll give you a few more seconds. All right. So it is going to be correct. It is going to be D. Remember, the triceps brachii is going to be an extension. It's going to help with extension of the arm. And it's also going to be, specifically the long head of the triceps brachii is going to be the lateral border of the quadrangular space. So yes, that is correct. Remember, the teres minor is going to be the superior border. The teres major will be the inferior border. And then you have the shaft of the humerus, which would be the medial border. So here's, we talked about the trapezius, the latissimus dorsi already in the back lecture. Subclavius, he talked a little bit about it, but I really don't think I think it's actually low yield. Because in gross lab, you rarely even see the subclavius. It's super hard to see. I was actually believing it wasn't even a muscle. It's so small. It's just going to be right underneath the clavicle, and it's just going to stabilize the joint, I guess. So he talked about like if you rupture your clavicle, it can protect you from getting your axillary artery punctured, right? But that's about it. Okay, so pectoralis minor. So for pectoralis minor, remember, I would write a list down of things that attach to the coracoid process. Pectoralis minor, short head of the biceps brachii, as well as the coracobrachialis. So I would write those three down and be like, okay, those attach to the coracoid process if you ever like ask a question like that. So just to like categorize things so you don't forget. So remember, the pectoralis minor is going to attach over here, surfaces of the ribs 3 through 5. It's going to attach to the coracoid process, super important. That's definitely how you. And remember, if we remember screw the lawyers save a patient, then we know the thoracoacromial artery, which is going to stand for the T, that's going to have the pectoral branch, which obviously is going to supply the pectoralis major as well as the pectoralis minor, right? And again, another high yield topic, pectoralis minor only supplied by medial pectoral nerve, right? Only medial pectoral nerve. The pectoralis major is going to be medial and lateral pectoral nerve. So here it is right here. This is our pectoralis minor. So you can see attaching to the coracoid process. Again, I just inputted this image just to give you like a picture perfect view of it. Look at it just attaching to the coracoid process. Is doing the same thing over here, right? Again, I wrote another note just so you don't get confused. Remember, pectoralis major, medial and lateral pectoral nerves. Pectoralis minor, only medial pectoral nerve. So serratus anterior, I'm going to talk about. This is like literally my favorite muscle in the body. I don't know, because it's called the boxus muscle. It helps with protraction of the scapula. I think it's just a really low key and super cool muscle. It looks like a serrated knife. So this is going to be the serratus anterior. So it's important for us to realize that the long thoracic nerve and the lateral thoracic nerve are going, long thoracic nerve and the lateral thoracic artery are going to supply the serratus anterior. So for you to remember, to help you, that long thoracic nerve is going to be a nerve. Remember, long has N while lateral has A, because some people confuse, okay, is long thoracic a nerve or artery? Well, you remember long has an N, so it's a nerve, long thoracic nerve. Lateral thoracic is going to be an artery because it contains an A, right? And again, if you remember, it attaches to the medial border of the scapula, which would be, you can't see, but it would be over there. And it's going to bring the scapula forward, so protract. So that's how we know the serratus anterior helps with protraction. It helps with boxers such as Muhammad Ali to throw these punches, right? That's going to be the serratus anterior. So here it is right here, looking like a serrated knife right here. This is going to be the serratus anterior. Remember, long thoracic nerve. So N for in the long is going to help us to remember we have N for nerve, right? Lateral thoracic artery, A in lateral means it's going to be artery. So again, here we can orient ourselves again if we wanted to. Remember, if I just remember the mnemonic, I should be able to label everything on here. I'm like, okay, screw the lawyer, save a patient. Screw the lawyer, save a patient, right? This is going to be superior thoracic. This is going to be, so screw is going to be right here, superior thoracic. The, which would be thoracoacromial right here. L is going to be lawyer. Remember, the lawyer is going to be L, so lateral thoracic. Save is going to be S, subscapular. But when I hear subscapular, and when you all hear subscapular, think, okay, first you must go under, then you must go around. So subscapular artery, then you have circumflex scapular artery. And then don't forget this one. This is thoracodorsal artery. And then over here, you're going to have A and P. So anterior circumflex femoral as well as posterior circumflex femoral, right? But on this slide, what he basically talked about is that you have the lateral thoracic artery, which is supplying the serratus anterior, as well as the nerve to the serratus anterior, also known as the long thoracic nerve. So true or false, if you sever the lateral pectoral nerve, this muscle will have an inability to contract.
Sometimes you just don't know how to start a video.
Give you a few more seconds. Okay, so yes, it is going to be B, false. So this is going to be the pectoralis minor, right? Remember, the pectoralis minor is only going to be innervated by the medial pectoral nerve. So if you sever the lateral pectoral nerve, your pectoralis major is basically going to be working at half the capacity, right? Because pectoralis major is going to be supplied by the lateral pectoral nerve as well as the medial pectoral nerve. But remember, pectoralis minor is only medial pectoral nerve. So if you sever the lateral pectoral nerve, the pectoralis minor would be totally fine. So we talked about the rhomboids before, as well as the levator scapulae. So we won't need to touch upon that too much. So teres major and the rotator cuff muscles, right? So I inputted a little slide here to help you all remember the rotator cuff muscles. Remember, the rotator cuff muscles, the best way to remember it is sits. But I always remember it sits with a lowercase t. The reason why I remember it with a lowercase t is because you want to remember it for teres minor, not teres major, right? So whenever you write this out or you write your notes, I would always remember, or I would advise you all to write sits with the lowercase t. That's why I remember it's going to be teres minor. Teres major is not part of the rotator cuff muscle. So this would be supraspinatus. This would be infraspinatus. This would be teres minor. And then you also have subscapularis, which you can't see right here, but it'd be located right here. So he wrote out, actually wrote out the whole thing here because I think he wrote like S-scap or like artery and like S-scap nerve. So I remember when I was going through the lecture like last year, I was like, is he talking about subscapular or is he talking about suprascapular? So I just wrote it out for y'all just to make sure. Remember, it's going to be suprascapular artery as well as suprascapular nerve, right? So the suprascapular artery is going to be going above the superior transverse scapular ligament. Remember, when it's artery, think above. So suprascapular artery above, suprascapular nerve below. Right, so you're going to have the supraspinatus and the infraspinatus. Remember, the suprascapular artery and nerve are only going to supply the supraspinatus as well as the infraspinatus. The teres minor and the teres major have different supplies. Remember, the teres minor, which is still a rotator cuff muscle, is going to have a different supply. It's going to be from the axillary nerve. Super important. Remember, I told you all in the beginning of this lecture, I was like, the axillary nerve is going to only innervate two structures. The deltoid muscle that we talk about, the deltoid muscle, as well as the teres minor. Remember that, so teres minor. Lower subscapular nerve is going to innervate the teres major. So we'll talk about that a little bit more, but remember the lower subscapular nerve is going to innervate the teres major. When we talk about the subscapularis later on, that's going to get the lower and upper subscapular nerve. This is going to make a little bit more sense when we start talking about the brachial plexus in the next lecture. Question?
Can you go back one slide?
Right here?
No, one more. There we go. Thank you. No, wait, you want two more.
Oh, okay, yeah. There's a lag. I didn't even notice. Okay.
Okay, I was trying to figure out where this the subscapularis was in the picture, but it's anterior. Okay, sorry about that.
Oh no, you're good. Yeah, it's hard to see, but we'll see it in other pictures.
Okay.
Okay, so we talked about this. Okay, so again, this is just to reiterate. Remember, I put the slide right here. This is the quadrangular space. Here's all the borders. And remember, only AP students can go to the quadrangular space, meaning axillary nerve as well as posterior circumflex femoral, right? And these are going to be the respective borders. Remember, so teres minor, which is right here, this has to be the superior border, right? Long head of the triceps brachii is going to be the lateral border. Teres major, which is right here, is going to be the inferior border, and then the shaft of the humerus is going to be the medial border. Which rotator cuff muscles are innervated by the suprascapular nerve? Is it A, the supraspinatus, B, the infraspinatus, C, the teres minor, D, the subscapularis, E, A, and B, or F, all of the above? All right. So yes, it's going to be E, right? E is going to be A and B, supraspinatus and infraspinatus. Remember, suprascapular nerve is going to supply the supraspinatus as well as the infraspinatus. So for teres minor, it's going to be the axillary nerve. What's going to be another muscle that the axillary nerve supplies? Can somebody tell me?
Deltoid?
Yep, deltoid muscle, yes. So the axillary nerve is going to supply the teres minor as well as the deltoid muscle. Subscapularis is going to have the upper and lower subscapular nerve. The reason why I'm telling you this like so early on is because eventually he's going to be talking about this, and he also put it on his little innervation of the limbs PowerPoint. I don't know if you all saw that. That's located on his modules. It's like the last one for the exam block, which is going to have the innervations for every single muscle that you all will need to know. And he did put this on there, so that's why I wanted to make sure you all knew that the subscapularis is going to have upper and lower subscapular nerve. I mean, feel free to match this if you want. I'm not gonna match it, but eventually you're gonna learn all of these in their respective ways in regards to like what they supply, how they look on cadavers, etc. So if you want to label it, you can, but I'm not gonna label it. I'll talk about the he put the omohyoid here, which I thought was really interesting because he didn't talk about it. But just know that I don't know if he's gonna test on it, but he put it there, so I was like, okay. I would think it's just a little bit important just to talk about it. So the omohyoid actually depresses the hyoid bone. The hyoid bone is actually going to be like a bone that's located in your neck. It's kind of like, it's like in your neck, deep in your neck, basically. It's kind of deep in your neck, but an anterior portion of your neck, right? It's going to go, your omohyoid is actually going to attach from your hyoid bone all the way to your scapula. So this muscle is really interesting because it's super long. It goes from your neck all the way to your scapula. It's quite interesting, but I think the reason why he put the omohyoid muscle there is because it attaches to the scapula, right? So I would just know that it depresses the hyoid bone and it's attaching to the scapula. Just in case he throws like a huge curveball, I wanted to talk about it so we didn't miss it because he did write on his slide. So I was like, okay, let me just talk about it just a little bit. So for rotator cuff muscles, again, remember sits with a lowercase t. So it's supraspinatus, infraspinatus, teres minor, as well as subscapularis. All right, so this is high yield, definitely testable material. I would note this. I would remember this. I would put this on your wall. Remember that the radial nerve as well as the deep brachial artery is going to run down the spiral groove. Remember, that's super important. Remember, the radial nerve and the deep brachial artery are going to run down the spiral groove. If we know that the spiral groove, which is going to be posterior to the humerus, then we should be able to know that the radial nerve and deep brachial artery are going to run through that, because eventually we'll go through like the next lecture, which shows that the radial nerve is going to innervate or supply the entire posterior compartment, and the deep brachial artery is going to supply the posterior arm. So then if we know that, then we know that these two are going to run through the spiral groove. So again, I would write that down. And remember, this is the quadrangular space over here. Who can pass through the quadrangular space? Those are only going to be the AP students, right? Only AP students can pass through the quadrangular space, axillary nerve, and posterior circumflex femoral artery. So which of the following is a branch off of the thyrocervical trunk that supplies the trapezius? Okay, so it's actually going to be, yes, C, transverse cervical artery. So remember, transverse cervical artery is going to be coming off the thyrocervical trunk. Remember, our vitamin C and D. Remember, the T is going to stand for thyrocervical trunk, which gives off suprascapular artery as well as transverse cervical artery. Transverse cervical artery is going to supply the trapezius. The suprascapular artery is going to supply the supraspinatus as well as the infraspinatus, right? And again, it's also cool to note that the dorsal scapular artery is also going to supply the trapezius, which is why I put this throwback tip, right? Dorsal scapular artery as well as transverse cervical artery are going to supply the trapezius. So he put the rotator cuff muscles right here. I mean, other than the fact that this is the rotator cuff, I think that's all you need to know based on this picture. So I would know all these pictures that we're going to talk about right now. They're super important. He can definitely test this on the exam, which is why I put some questions on it. So yeah, this will be the subscapularis for you all that were wondering. This will be the subscapularis. This will be a rotator cuff muscle. And what I would do, I'd be like, okay, I would write here, okay, upper and lower subscapular nerve is going to supply the subscapularis, right? That's going to be very important to note. So like I said, if you want to write things down in correspondence to their cadaveric images, that should be able to help as well. So for the next one, you have the supraspinatus, infraspinatus, as well as teres minor, right? So this is going to be the supraspinatus. This is going to be the infraspinatus. So it's important for us to realize this is the teres minor, and what separates that is going to be this right here. It's hard to see, but this little white line, right? So if he points right here, this is the teres minor. But if he points over here, this is going to be the infraspinatus, right? They're all going to be rotator cuff muscles. So here's the infraspinatus right here. Here's the teres minor, right? So again, here's this little line separating them, right? This is going to be the infraspinatus, and this is going to be the teres minor. Super important to note that. And again, remember, the supraspinatus and infraspinatus are going to be supplied by the suprascapular artery as well as the suprascapular nerve, right? The teres minor is going to be innervated by the axillary nerve, right? It's going to be axillary nerve, super important. So here's the teres major, which is why it's not part of the rotator cuff muscles. So you see it attaches all the way to the medial lip of the bicipital groove. So and it doesn't do what the rotator cuff does. So it doesn't like keep the humerus into the glenoid cavity as much as the rotator cuff does. So this is the teres major. It's also important to note the coracobrachialis, which would be right here. I talked about this, or I put this on a question in the exam or like in the quiz for this Friday, that the musculocutaneous nerve. So if you guys actually take Gross Lab in the spring, if it's offered, you'll actually be able to see if you pull out or if you expose the coracobrachialis, you most likely would see the musculocutaneous nerve puncturing right through the coracobrachialis, which I'll talk about the next lecture, which is really cool. So that'll be that. So this muscle shares an innervation with another muscle. Or with which other muscle? So yeah, so this muscle shares an innervation with which other muscle? So we're talking about this one right here. So A, B, C, or D. I know it's a little difficult. This is a difficult one. Okay, so I'll help you out with this. So basically, this muscle right here is going to be the subscapularis, right? This is going to be the subscapularis. Does anybody remember what the innervation of the subscapularis will be? You could just say it out loud.
Subscapular nerve?
It's actually, it's close, but it's actually going to be, oh yeah, subscapular nerve, yes. but it's going to be upper and lower subscapular nerve. So yes, that is correct. Remember, it's going to be upper and lower subscapular nerve. The correct answer is going to be teres major, because remember, I talked about this earlier, the teres major is going to have the lower subscapular nerve. So technically, these two muscles share the same innervation supply in regards to the lower subscapular nerve. The subscapularis also contains the upper subscapular nerve. So when I said this muscle shares an innervation with which other muscle, it would be the teres major, because the teres minor is going to have the axillary nerve. The axillary nerve doesn't supply the subscapularis. This is the subscapularis, so I said other muscle. And then triceps brachii is going to be the radial nerve. Does that make sense? All right.
Does teres major have any other innervations other than
No.
Okay.
Yeah, it's only going to be the lower subscapular nerve. And then
no, I just wanted to ask one more question. Just going back to the rotator cuff, I know he had mentioned that one of the muscles in the rotator cuff is the most common for tears, especially in baseball players.
Mm-hmm.
Which one was that?
Yeah, we're gonna get to that slide, and it's actually the supraspinatus, and it's due to its lack of vascularity. So I think that's gonna be the next couple slides, and we'll talk about that. Gotcha. Okay. So nothing too important here. Just know that the rotator cuff muscles are going to ensure that the humerus is going to stay in the glenoid cavity, so you don't just dislocate your humerus, right, from your shoulder joint. The most important thing on this slide, I put it just in this little box, is that the supraspinatus is going to assist with 10% of the abduction, right? So the first 10%, if you would just stand still and you keep your hands side to side and you would abduct your arm, so abduct, the first 10% is going to be the supraspinatus. The next 90% is going to be the deltoid. So that's going to be helping with the abduction once you pass that 10%, basically. So that's the most important thing to note from this slide. Here is what we were talking about. So baseball players are normally tear their rotator cuff muscles, but the one that's most commonly torn, what I wrote right here, is going to be the supraspinatus, right? And that's due to its location and its lack of vascularity, right? That's going to be the supraspinatus. So that's important. So if he does, what's going to be the most common rotator cuff muscle torn, it would be the supraspinatus, right? So what is the arterial supply of this muscle? There's another comprehension check question. Oh, and by the way, the teres major, Lindsay, is going to be the lower subscapular nerve. And then the teres minor is going to be the axillary nerve. Okay, I'll give you all a few more seconds. Okay. Oh, wait, lost the chat for a second. Give me 1 second. Okay, so yes, my bad, I just got the chat back. Okay, so it's going to be the lateral thoracic artery, right? So remember, this is going to be the serratus anterior. This is your boxer's muscle, right? This is like literally Muhammad Ali's muscle right here. This is going to be the muscle that helps with protraction. Remember, the lateral thoracic artery is going to supply the serratus anterior. The thoracodorsal artery will be latissimus dorsi. Suprascapular artery would be supraspinatus as well as infraspinatus, and dorsal scapular artery will supply 4 muscles. It's going to be the trapezius, the rhomboid major and minor, as well as the levator scapulae. Okay, it's not too important. So last year I didn't study too much off of these slides because, the ligaments have the names in and of themselves. So for example, like coracoid-chromial ligament, just going to be connecting the coracoid process to the chromium. You have the coracohumeral ligament, which is literally going to be from the coracoid process to the humerus. So I didn't study these too much, so I wouldn't say they're too high of you. So you're going to have bursa, So you're gonna have bursa, which is basically just gonna help limit the rubbing of a muscle onto bone, right? I would just note that you have a subdeltoid, so you have one with below the deltoid muscle, and you also have one beneath the acromion. So you're gonna have a subdeltoid and a subacromial bursa. Remember, this bursa is there to make sure you're not rubbing your muscles too hard onto your bone, right? Again, I didn't study this too much. I think just the most important, I guess the most important thing on the slide would just be that each rotator cuff muscle has a tendon. So supraspinatus, infraspinatus, teres minor, as well as subscapularis, all going to have a tendon. And you're also going to have superior, middle, and inferior glenohumeral ligaments, which is just going to help hold the humerus into the glenoid cavity, right? That's about it. Same thing over here. The only thing I would extra note is, remember, only AP students can go through the quadrangular space. So axillary nerve, as well as posterior circumflex humeral artery. And again, just know that you have a labrum, which is going to help stabilize the humerus there, and it can be easily torn. Other than that, I have one more question and we'll move on to the next lecture. So what is the innervation of this muscle? Oh dang! I forgot to cover. I forgot to cover the name. It's fine. It's all good. All right. Give you a few more seconds. So yes, it is going to be A, the axillary nerve. Remember, the axillary nerve is going to supply the teres minor. The suprascapular nerve is going to supply the supraspinatus and the infraspinatus. The lower subscapular nerve is going to supply the teres major. Remember, teres major. The upper subscapular nerve, as well as the lower subscapular nerve, are going to supply the subscapularis. So that's going to be it for that slide. I'll give you guys like a 3-minute break, but just feel free to ask me questions if you have any. So we'll start again at like 6:20, like 7. Oh, so can I clarify the medial and lateral borders of the quadrangular space again? Yeah, of course. Okay. Medial. Right here. So the medial border is going to be right here, the shaft of the humerus, right? So think of this is let me get my laser pointer. So this is the quadrangular space, right? Right here, this will be the quadrangular space. The medial border would be the shaft of the humerus, right? So this shaft of the humerus would be the medial border. The lateral border, this is going to be the long head of the triceps brachii, right? Yeah, the lateral border is going to be the long head of the triceps brachii. The superior border is going to be the teres minor, and then the inferior border is going to be the teres major. That makes sense? Yeah. Okay. Let's see. All right. Does anybody have any other questions before I share my screen again and then we start the second lecture? Sorry, we might go a little bit over time. It's just I'm trying to make sure I'm like getting like the best out of these complex materials and making it as easy as possible, because the axillary artery and its branches and the subclavian, as well as the brachial plexus, is going to be very difficult to go over in such a short amount of time. I'm just trying to make sure it's very helpful as well as concise. Okay, So if there are no more questions, I'm going to share my screen and then we'll start. All right, everybody can see this, right?
Yes.
Okay, perfect. All right, so we're gonna go to the axilla and the arm. So I'm gonna try and break down the brachial plexus for you all and make it as simple as possible. But eventually, you know, you're going to have to just keep practicing and keep trying to draw out the brachial plexus to learn it as best you all can. But I'm going to try and break it down as much as I can throughout this lecture. So we're going to start. So here are the axilla and its contents. So for the axilla's contents, you have the boundaries, which I feel like are going to be definitely important. You have the anterior, medial, lateral, posterior, as well as the base. So I put this like 3D cone right here because it gives you like a better representation of what the axilla region is, right? So the anterior border is going to be the pectoralis major and minor. So if you look over here and you're like, okay, the axilla region looks like this 3D cone shape, right? The anterior part is going to be this red line, I guess just like this arbitrary red line, right? It's going to be the pectoralis major and minor. So you can see how this is going to be the anterior border, right? The medial border is going to be shown in purple, right? Which is going to be the serratus anterior, which is right here. You can see it. Obviously, you can't see the muscle, but it'll be located here in this purple area. The lateral border, as you can see, is going to be shown in blue right here. That's going to be the proximal shaft of the humerus, right? And the posterior border will be the subscapularis, the teres major, and latissimus dorsi. And then the base will be the skin. So we'll go over this, but I feel like this picture does us some justice about how to look at the axillary artery, how to look at the axillary region in its 3D representation. So he labeled a few of these things that I feel like some of them are important, so I'll touch upon them. So the neurovascular bundle, remember whenever they say neurovascular bundle, they're just basically saying a bunch of like arteries, nerves, and veins running together, right? So the brachial plexus, the axillary artery, as well as the axillary vein, all running together in the neurovascular bundle, right? So you can have the posterior, the anterior, as well as the floor. So we talked about this already. So if we think about our 3D cone, the anterior is going to be the pectoralis major and minor. The posterior would be the subscapularis, teres major, and the latissimus dorsi. And the floor would just be the skin, right? Or the skin of the armpit. So all of these are included in the posterior border of the axillary region, except A, the teres major, B, the subscapularis, C, the latissimus dorsi, or D, the teres minor. So here comes another comprehension check question. Give it a few more seconds. Okay, so it is going to be D. Yes, the teres minor. So yes, I went by the slide a little bit quickly, but I wanted to show you all that for the axillary region, which is located right here, if you picture it's going to be located right here, they included for the posterior border the subscapularis, the teres major, and the latissimus dorsi as the posterior border, right? So that means if they didn't include the scapula, which is obviously going to be posterior to these things, that means anything posterior to the scapula is not included into the axillary region because those are like back muscles or like rotator cuff muscles, right? So again, or like further away rotator cuff muscles, right? So this is why they put the subscapularis, the teres major, and the latissimus dorsi because it kind of makes like a line right here, if you can see. It's going to make this posterior border, right? Which is why they don't include the teres minor. So I wanted to note that for you all, so you can keep it in your notes. So here, we're going to talk about the brachial plexus. So remember, the brachial plexus is going to have, it's going to go from C5 to T1. So I noted here, we have 7 cervical vertebrae, but we have 8 cervical nerves. And the reason for that is because we have the first cervical nerve, or C1, or the first cervical nerve is going to start above C1, which is why we have 8 cervical nerves. So we'll be talking about the brachial plexus throughout. So he gave us a little mnemonic like Randy Travis drinks cold beer. You can say reach to drink cold beer. You can say real Texans drink cold beer, whichever RT is going to help you remember the roots, trunks, divisions, chords, and branches. I feel like you should definitely use. So these would be the roots. These would be the trunks. These would be the divisions right here. These would be the chords, and these would be the branches. So don't worry. I know I rushed through it a little bit quickly, but we're going to be going through these step by step as we look through the cadaveric images. So, but just a little note about the trunks. Remember the trunks, when they name upper, middle, and lower, they're literally called upper, middle, and lower because this one is going to be upper to this one, and this one's going to be the middle, and this is going to be the lower. So that's why they call them upper, middle, and lower. But for lateral, posterior, and medial chord, these chords are named in regards to their relation to the axillary artery. So picture the axillary artery just coming out here and on top of this posterior chord, right? So just coming straight down here. So you can tell this little nerve thing or this nerve supply would be called the lateral chord because it's lateral to the axillary artery. This one is called the medial chord because it's medial to the axillary artery. And then you have this one, which would be P, which would be a posterior chord, is going to be posterior to the axillary artery. So they name the chords based upon how they are in relation to the axillary artery. So I'm going to use this image because it's like the picture perfect image of the brachial plexus when we start talking about all these cadaveric images so that you get to like compare what it looks like in a cadaver and what it's supposed to look like picture perfect, right? So you can get like a really good grasp of what they're trying to show you in the cadaveric images, right? So we'll use this image and then we'll definitely compare it into with the cadaveric images as we move on. So yes. So another thing I wanted to note about was that the lateral pectoral nerve is only going to supply the pectoralis major. Again, I like to repeat just to make sure it sticks to you guys. Remember, lateral pectoral nerve, only pectoralis major. The medial pectoral nerve is going to be both the pectoralis major as well as the pectoralis minor. And this is going to be a throwback tip. The thoracodorsal nerve is going to supply the latissimus dorsi. Remember, thoracodorsal nerve, mid-subscapular nerve can be used interchangeably. So mid-subscapular nerve is the same thing as thoracodorsal nerve, and it's going to supply the latissimus dorsi. So again, let's see. Okay, so we're gonna eventually go through these. I like to break them down better when we have the cadaveric images with us. But again, remember, reach to drink cold beer, or real Texans drink cold beer, or Randy Travis drinks cold beer. Remember, R is going to be roots. So this is going to be roots over here because remember, these are all going to be your roots. Then you're going to have your trunks, which will be located right here. These will be your trunks. Then you have your divisions, which will be located right here. These would be your chords. Remember, your chords are in relation to your axillary artery. So your lateral chord is lateral to the axillary artery. Your posterior chord is going to be posterior to the axillary artery. And then the medial chord is going to be medial to the axillary artery, right? And then you have your branches over here, which is super, super important, right? Which so we'll talk about later, which would be musculocutaneous. Is there a question? Somebody's mic's on. So musculocutaneous, axillary, radial, median, and ulnar. So we'll go through this step by step. So obviously he's not going to test you on this. I'm just using this just to help you all remember. So what are the structures covered by the boxes below? So this is going to be obviously a picture perfect brachial plexus, but what would these structures be called? Are they chords? Are they branches? Are they trunks? Or are they divisions? Okay. So yes, they are actually going to be chords, right? So lateral chord, lateral to the axillary artery, excuse me. Posterior chord, posterior to the axillary artery, and medial chord, which would be medial to the axillary artery. So here's a subclavian artery and its roots in the brachial plexus. So the only thing he noted about this slide was that the brachial plexus comes out between the anterior and middle scaling muscles, right? So anterior, which would be located right here, and this is going to be the middle scaling muscles. I mean, he said it. I don't know how important it was, but I mean, I wrote it down just in case, so you guys can know. But remember, these would be the roots of the brachial plexus coming right out between the anterior scaling muscle as well as the middle scaling muscle. So I noted that here just in case you need to know that. So we're gonna go through a bunch of cadaveric images, and I want you guys, please feel free if you lose me or anything like that, because I want to make sure you understand, especially these cadaveric images, because it gets a little more complex as we get towards the branches, right? So I'm gonna input, or I inputted this picture in every single slide for us to realize the comparison between the picture-perfect brachial plexus as well as what it looks like in a cadaver. So this is going to be the roots, right? So this would be the roots over here, the roots of the brachial plexus, and this would be the trunks, right? So upper, middle, and lower, right? So over here, this is what we're talking about. These are the roots, and these would be the trunks. Remember, superior, middle, and inferior is the same thing as saying upper, middle, and lower, right? That's going to be that right there. This is going to be the anterior scaling muscle, and this will be the posterior scaling muscle. The anterior scaling muscle, and this will be the middle scaling muscle. Remember that the brachial plexus is going to be coming in between there. Next, you're going to have the divisions, right? So you have an anterior division, which is located right here. So if we follow right here, this is going to be the anterior division that we're talking about in our picture-perfect brachial plexus, right? This would be the anterior division. And then we have the posterior division, which would be located right here. This would be the posterior division. So again, we said this would be the divisions of the brachial plexus. As you can see, this would be what it looks like in a picture-perfect one, and this is what it looks like in a cadaveric image. And it's also important to note that this is going to be the axillary artery, right? This is the axillary artery. So I know it's hard to tell the difference between arteries and nerves once you start looking at cadaveric images, but I guess a little quick tip or a little note to help you differentiate them is that nerves kind of look like, to me, like rubber bands, right? So these nerves look like you can stretch them really far, right? They look like rubber. Well, axillary arteries, which is over here, or the arterial supply, you can see is more like formed, right? It's usually more formed, it's usually more round. So you can tell that this is the axillary artery. So for the next one, you're going to have the cords, right? So remember, like we talked about again and again, remember the cords are going to be in relation to the axillary artery, right? So the lateral cord is going to be lateral to the axillary artery. The posterior cord is posterior to the axillary artery. The medial cord is medial to the axillary artery. So they move the axillary artery, obviously, so to see these lateral, posterior, and medial cords, right? So this would be the lateral cord, and this is going to be located right here, right? This is the lateral cord. This would be the posterior cord, and this would be the medial cord, right? So again, you see the same thing up here, right? Lateral cord, posterior cord, and medial cord, right? And then when you see this famous M, right? This is the famous M of the brachial plexus. When you see this M, you can locate yourself anywhere along the brachial plexus. This M is going to be a key marker on any of the pictures that you see regarding cadaveric images. So once you see this M, right? So you see the M right here. So this is going to be M, right? You see right there. This is going to be what is corresponding to this image right here. Musculocutaneous coming over here, giving part to median nerve giving part to ulnar nerve, right? So this M right here. You see that? That's going to be the same thing that's shown right here, right? So this is going to be the musculocutaneous nerve, right? Because we see right here, the musculocutaneous nerve is an extension of the lateral cord, right? This would be the lateral cord. The lateral cord extends to the musculocutaneous nerve, right? So this would be the lateral cord extending and turning into the musculocutaneous nerve, right? We're also going to have the median nerve, which is located right here with my laser pointer, right? This is the median nerve. The median nerve, which is located right here, gets contributions from the lateral cord as well as the medial cord. So you can see here's the median nerve getting contributions from the lateral cord as well as the medial cord, right? And the last part of the M is going to be the ulnar nerve, which is right here. This is going to be the ulnar nerve, right? The ulnar nerve is an extension of the medial nerve. The ulnar nerve is an extension of the medial cord. So the medial cord is going to extend into the ulnar nerve, which is located right here. So this back here would be the medial cord turning into the ulnar nerve. Does anybody have questions regarding that? Is that clear?
I just wanted to know if you could help me orient myself again with the cadaveric images. Can you just where would say the spinal cord be in relation to the top right photo?
So for the top right photo, so spinal cord. So this is a little bit easier because, so you know that the cords are going to come before the branches, right? So it's going to be cords and then the branches, right? So when you start getting towards the branches, you're going more further down the arm, right? These cords, like we said, are more. This is going to be, for example, like the I believe this is going to be the clavicle, right? The clavicle or the first rib. So this is going to be there. And then you see this is going to be going down the arm, right? This is going to be the cords first, and then eventually this image is going to be further down here. So technically the M is like over here, but you can't see it too much. And that's why they show it over here. This is going to be the branches, right? This is going to be right next to your body. So it's kind of hard to like picture the spinal cord because you won't be able to see the spinal cord too well in images like this.
And these photos are taken from an anterior perspective?
Yes.
Okay.
Does that help a little?
Yeah, a lot. Thank you.
Okay, gotcha. All right, so anybody have any other questions regarding that? Because I know it's hard looking at cadaveric images and trying to compare what is what basically for nerve supply. Okay. So for the next one, again, you want to find this. If you find this M, you know exactly where you are, right? This M is going to be super important. This is going to be containing the musculocutaneous nerve right here, which is then going to give contribution to the median nerve, and median nerve gets contribution from the ulnar nerve. So this is that M right here, right? So musculocutaneous nerve, median nerve, ulnar nerve in this picture perfect brachial plexus, right? So again, if they were to point, what is this right here? This is going to be the lateral cord, right? Because I know this is the M, so this has to be musculocutaneous. If I know musculocutaneous is just an extension of the lateral cord, then this would have to be the lateral cord, right? So this is why how the M helps so much, right? So again, and I'm like this, okay, so if they point over here, they're like, okay, what's that? And I'm like, okay, so I know this is the M, this is the ulnar nerve. The ulnar nerve is an extension of the medial cord, right? The ulnar nerve right here is an extension of the medial cord, right? So you can see that right there. So again, like we said, when you locate this M, it's going to be your savior. So it's going to help you a lot, right? So over here, we talked about the same thing over here. And then you have here is going to be the axillary nerve, and then this is going to be the radial nerve. To help you out with that, if you see a nerve that's just going to be like basically dipping or just like going away, like just like leaving leaving the brachial plexus, that's odds are it's the axillary nerve, because the axillary nerve is going to go straight through the quadrangular space. Remember, only AP students can get through the quadrangular space, which is the axillary nerve, as well as the posterior circumflex femoral artery, which you can't see here. The axillary nerve is going to supply two muscles. Does anybody know which two muscles the axillary nerve is going to supply?
Teres minor and the deltoid.
Yes, nice. The teres minor and the deltoid muscle. So this would be the axillary nerve. So for us to orient ourselves in the picture perfect brachial plexus, here's the axillary nerve, right? Axillary nerve is going to be coming off the posterior cord, right? So if I label this over here, I'm like, okay, what is this? You know this is the posterior cord because the axillary nerve is going to branch off of that. The radial nerve is just an extension of the posterior cord as shown right here, right? This is the radial nerve, and it's extending from the posterior cord, right? So the radial nerve is an extension of the posterior cord, right? So that's how you can know that this is going to be the axillary nerve, and this will be the radial nerve. So for the next one, this gets a little more in depth, so stay with me here. So here we are with our M again, right? Our M, yeah, so now we found our M, we feel better, right? This is going to be, now if we know our M, we know this is going to be musculocutaneous down here. This is going to be median nerve, and this is going to be ulnar nerve, right? So remember, musculocutaneous, if we remember that musculocutaneous is an extension of the lateral cord, then we would know that this is the lateral pectoral nerve, right? Because there's only one branch off the lateral cord, which I located right here, the lateral pectoral nerve. So this would have to be, by default, lateral pectoral nerve. And lateral pectoral nerve is only going to supply the pectoralis major, right? And then over here, you won't be able to see the medial pectoral nerve, but actually, yeah, you will. This would be the medial pectoral nerve, but you won't be able to see the medial cord because the axillary artery is covering it. So again, this will be ulnar. Ulnar nerve is an extension of the medial cord as shown right here. The medial cord is going to give off the medial pectoral nerve, which would be located right here. And it's the same thing over here. All right. So you have the more posterior cord branches. So you see, look at this. This little nerve, it looks like it's just dipping, right? It's just leaving the brachial plexus, like peace out, I'm out. This is going to be the axillary nerve. That gives you a big red flag that that's probably going to be the axillary nerve. Remember, only AP students can pass through the quadrangular space, axillary nerve, as well as posterior circumflex femoral artery, right? So that'll be the axillary nerve. If we know that that's the axillary nerve, this has to be the radial nerve because the radial nerve is an extension of the posterior cord, right? This is why he puts this little picture here, right? He puts a picture of the deltoid muscle right here because he's like, okay, I want to give you like a background picture of like, so sometimes he will give you a background picture like this to locate exactly where you are. And he's like, what's that, right? But he's like, based off this picture, what is that? This would have to be the axillary nerve because it supplies the deltoid muscle, right? Over here, he does the same thing, right? You're going to have the subscapularis. This is the subscapularis muscle, right? Here, if we look, he labels these as the posterior cord and its branches, right? So if this is the posterior cord, we know that you're going to have a lower subscapular nerve, a thoracodorsal nerve, which is the same thing as middle subscapular nerve, and an upper subscapular nerve. Remember, the lower subscapular nerve is only going to supply the teres major. The lower subscapular nerve supplies the teres major. And remember, the upper and lower subscapular nerve are going to supply the subscapularis, right? So it's important for us to note that. And this is going to be the thoracodorsal, also known as the middle subscapular nerve, right? So this is going to be thoracodorsal. This is lower subscapular nerve, thoracodorsal, and upper subscapular nerve. Lower subscapular nerve, thoracodorsal, upper subscapular nerve. So these are going to be really important. And I guess a key way to remember that this is thoracodorsal nerve is because it's so long, right? It's so long because it's going to go supply the latissimus dorsi, which is a very large muscle, right? So that's how you can pinpoint that this is going to be the thoracodorsal nerve because it's a very long nerve. So again, like I said, they pinpoint it right here as well. This is going to be the thoracodorsal nerve, right? And he gives us a little hint right here because he's like, okay, so what's this? And I'm going to give you a hint. What muscle is that? So this muscle, if you know, is going to be the latissimus dorsi. And then you know that this has to be the thoracodorsal nerve, right? If this is the thoracodorsal nerve, this would be the lower and this would be the upper subscapular nerve. So I hope that helps a little bit, especially using this picture perfect brachial plexus. So I added a lot of questions in regards to cadaveric images, just so you can have it as study material as well afterwards, because I know it takes a while to cover these. So I did a few questions covering certain labels, etc. So here it goes. Which nerve is the arrow pointing to, right? So this white arrow pointing to which nerve? All right. So yes, that is going to be ulnar nerve. So I hope you all realize you were like, okay, this is the famous M, right? This is the M that's going to save us, right? If you locate the M, then you know that this is going to be musculocutaneous nerve, right? Which is located right here. This is going to be median nerve, getting contributions from the lateral cord as well as the medial cord. And this is going to be the ulnar nerve, which is an extension of the medial cord. Wow, you all did really well on that one. Really good. Okay. So yeah, the axilla and its contents, right? So we'll just skip this slide because he didn't talk too much about it. So he talked about this paragraph, but I just summarized it in 2 bullet points on the next slide. So feel free if you want to write notes on this. I'm going to skip the slide, but I'm going to be talking basically about exactly what's important on this slide on the next one. So this is a summary of what he basically wrote in that paragraph. So radial nerve is the only posterior cord branch that innervates the posterior part of the arm, right? So this is the radial nerve, right? The radial nerve, what they mean, is going to be the only nerve that is going to innervate the entire posterior compartment of your arm. So I'm talking about the backside of your arm, as well as the backside of your forearm, and even the backside of your hand, basically, is going to all be supplied by the radial nerve. The reason for that is because your axillary nerve is going to dip. Remember, your axillary nerve dips and goes through the quadrangular space and supplies the teres minor as well as the deltoid muscle, right? Super important. This is why he can state that the radial nerve is the only posterior cord branch, because the only other posterior cord branch is the axillary nerve. Axillary nerve goes to the deltoid muscle and the teres minor. So the only other posterior cord branch that's going to supply the posterior part of the arm is going to be the radial nerve, right? And he also notes that the lateral and medial cords are going to provide innervation to anterior arm, forearm, and hand. So for example, we have the musculocutaneous, right? So you remember in my quiz question, I said the musculocutaneous can be easily found on the cadaver because it's most likely going to be penetrating right through the coracobrachialis. Since it's penetrating through the coracobrachialis, then you can assume that it's going to innervate the entire anterior compartment of the arm, which is true. When I talk about arm, I mean from shoulder to your elbow, right? So from your shoulder to your elbow is your arm. Your elbow to your wrist is going to be your forearm. You also have basically the ulnar nerve, which we'll talk about in later lectures when we get into the forearm, as well as the median nerve when we get into the forearm as well. So here we go with our mnemonic. Remember your daily dose of vitamin C and D, and you also have screw the lawyer, save a patient, right? So again, you can look at this. Feel free. What I would do if I was you all, I would just memorize the mnemonic, and I'll look at this and be like, okay, let me go down this entire thing and name everything, right? because you should be able to, if you remember your vitamin C and D, and you also remember screw the lawyer, save a patient, right? So that's what's going to, this kind of helps you remember where everything is located in regards to proximal to distal for the axillary arteries branches as well as the subclavian arteries branches. So which nerve is the black arrow pointing to, right? This nerve right here. Which nerve is the black arrow pointing to? I'll give you a few seconds, a few more seconds. Okay, so the black arrow is going to be pointing to the lateral pectoral nerve. Oh, I didn't highlight it. Wow, I forgot. But yes, it's going to be the lateral pectoral nerve, which is going to be A. That is correct. So again, if you locate your M, you should be able to realize where everything is, right? So your M is your go-to, right? M, so you're going to have musculocutaneous, which is, you can't see obviously here. It's going to be an extension of the lateral cord, right? You have the median nerve, which is going to be right here. This is going to be the median. It gets contributions from the lateral cord as well as the medial cord, which you can't see over here, right? And this is going to be your ulnar nerve, right? So if you remember, okay, they're pointing, the way I would look at this is like, okay, they're pointing at this structure. I found my M, and I know, if I know that the musculocutaneous is an extension of the lateral cord, and I know that the lateral cord, the only thing coming off the lateral cord is the lateral pectoral nerve, this has to be the lateral pectoral nerve, right? Because over here, as shown, musculocutaneous nerve is going to be an extension of the lateral pectoral nerve, and the lateral pectoral nerve, the musculocutaneous is going to be an extension of the lateral cord, and the lateral cord is going to give off the lateral pectoral nerve, which would be located right here. That is very correct. And this would be the medial pectoral nerve coming off the medial cord. See, I tricked the morning crew on this, but no, you guys weren't fooled by that. Good job. So arteries supplying the shoulder region. So again, here we go. We get to our bread and butter, our vitamin C and D, which is going to be coming off the subclavian. Remember, if this is going to be the subclavian artery, the branches is going to be the thyrocervical trunk, and you have the suprascapular artery as well as the transverse cervical artery. Remember, the T stands for thyrocervical trunk. What comes off the thyrocervical trunk is going to be the suprascapular artery as well as transverse cervical artery, right? And then you have C, you can't see costal cervical trunk, and then you also have dorsal scapular, which you won't be able to see here. Remember, branches of the axillary artery, screw the lawyer, save a patient. This is going to be thoracoacromial with its 4 branches. I mean, you can't see all 4, but it'll have 4 branches. Lateral thoracic, which would be right here. Remember, does anybody remember what the lateral thoracic is going to supply? Which muscle?
Serratus anterior?
Yes, the serratus anterior. Yeah, very good. The lateral thoracic is going to supply the serratus anterior. And then over here, you'll see your the SAP, so you save a patient, right? This is going to be the subscapular artery. Remember, so when I hear subscapular artery, I'm thinking, okay, first you must go under, then you must go around. So go under the scapula, so sub to the scapula, right? So subscapular artery is going to branch off into the circumflex scapular artery, and it's also going to give off the thoracodorsal artery, which you can't see here, obviously. But this is going to be the anterior circumflex femoral artery, and this right here will be the posterior circumflex femoral artery. Now, the posterior circumflex femoral is going to be a little bit thicker than the anterior circumflex femoral, which is why it's a little bit thicker here. Let's see. And then, it's important to remember that the posterior circumflex femoral artery is going to pass through the quadrangular space. Remember, only AP students pass through the quadrangular space, which is going to be the axillary nerve as well as the posterior circumflex femoral artery. Yes, I'll keep repeating those things. So again, he posted this on this last PowerPoint. So again, he posted it again on this one. If we remember all the branches, if we remember the vitamin C and D, and as well as the screw the lawyer, save a patient, we should be able to understand all these branches that are coming off the subclavian as well as the axillary, right? So again, I use this highlighted arterial supply as a marker for you to remember that this is the superior thoracic artery, right? If you know this is a superior thoracic artery, you should be able to go down the entire branch of the axillary artery. If you remember the mnemonic, screw the lawyer, save a patient, right? So superior thoracic, this would be thoracoacromial. So screw the lawyer, so thoracoacromial, lateral thoracic, save subscapular artery, which would be anterior circumflex femoral, and P, patient, which would be posterior circumflex femoral. Right, so you should be able to label all these and understand that the first part is going to be medial to the pectoralis minor, which is located right here, right? Medial. The second part is going to be deep to the pectoralis minor, which are these two branches, thoracoacromial as well as lateral thoracic. And then you're going to have lateral to the pectoralis minor, which are going to have three branches, the subscapular artery, the anterior circumflex femoral, and the posterior circumflex femoral. So remember, just know that typically nerves, all he stated was that typically nerves run in bundles with like arteries and veins. So that's why it's called a neurovascular bundle. It's going to contain nerves, veins, and arteries. So again, here's our bread and butter, vitamin C and D, as well as axillary nerve, which is going to be screw the lawyer, save a patient. So this would be our vitamin C and D all the way up to here. And this would be screw the lawyer, save a patient, this entire thing here. So again, feel free to label it if you want to. It's going to help you out using the mnemonic, and it's definitely going to help you easily figure out which one is going to be which. So which nerve is the arrow pointing to? So this is going to be another comprehension check question. So which nerve is this pointing to? Okay. So it is going to be the axillary nerve, right? So it's going to be the axillary nerve. I don't know. I thought I took the cover out, but yeah, it's going to be the axillary nerve, because remember, when you see a nerve that's like kind of like just going away and dipping from the rest, it's more than likely going to be the axillary nerve, right? Because that's the one that goes through the quadrangular space, and goes to innervate the teres minor as well as the deltoid muscle, right? And again, that's why I left posterior cord here, so it can give you a little hint, right? Because remember, if you remember the posterior cord, which is right here, the radial nerve is going to be an extension of the posterior cord, right? So this has to be the radial nerve extending from the posterior cord. What's going to be another branch coming off the posterior cord? That's going to be the axillary nerve, which will be located right here, and that will give you your answer D, axillary nerve. I'm doing more so identification so you guys can understand which ones are going to be, which structures are which in regards to the brachial plexus, but understand that it can obviously be much more difficult in regards to the questions. So for example, like they can say, you can be like, okay, so what is going to be the muscle that this structure innervates, right? So not only would you have to know what nerve this is, you also have to know what the muscle supply adds to, right? So and I can like take that a step further and bring it into three-step questions, right? So again, I want you guys to understand like that we have to understand like where everything is located first, and once we understand everything's located, then we'll be able to understand where it's going and what it's actually supplying. But yes, very good job, axillary nerve. That is the correct answer. So we'll talk about the arm for a little bit. A question.
Sorry, the one right next to it with the pink box, is that the median?
This is the radial nerve. So remember, because like we said, this is going to be the radial nerve. The reason why is because the axillary nerve is going to be coming off the posterior cord, right? This is the posterior cord. So if we see it, let's just see in this picture perfect one, right? This is the axillary nerve that we just pointed at, right? Which is located right here, axillary nerve. It comes off the posterior cord. So think about it coming off right here, and this is the posterior cord, right? The radial nerve is an extension of the posterior cord, right? So the radial nerve would be coming right here, and it would be an extension of the posterior cord, right? Extension of the posterior cord. Yeah. And yeah.
On an exam, if he would ask us to identify this, he wouldn't label that this is the posterior cord. He wouldn't give us a hint, correct?
Probably not, no. But I just gave it you as a hint. And another way that you can that could help that the reason why it's not like median nerve is because remember, if you don't see this M, like I don't see the M here, right? So if you don't see the M, you're probably looking at the posterior side of the brachial plexus, right? Because this is the M right here. You see my laser? This is the M. So if you remove this M, like if you lift it up, for example, you'll see the radial nerve as well as the axillary nerve, which is right here, right? Radial and axillary. Does that help?
Okay. Yeah.
Gotcha. But yeah, he
quick
probably
question.
won't label. Yeah.
Justin. So I was reading the textbook yesterday, and there were like some variations where instead of C5, it was started at C6. Do we have to know those?
So no, you won't need to know that. So you won't need to know like the variations in regards to that, because typically it's C5 to T1 in regards to the roots when it's talking about the brachial plexus. No, because most of the things on the brachial plexus are going to be very typical, and he's only going to test you on everything that's going to be typical. He won't test you on many exceptions. That's for gross lab. Does that help?
Yeah, thanks.
Okay, for sure. All right. Oh, and do you guys like find these questions helpful? Like, do you like when I post these questions, or do you feel like it's like too much? Because I mean, let me know. Because I just want to get you guys feedback to feel like if these questions are like too hard, or like if there's too many questions in between. I like to like make it a little bit more engaging, which is why I input these questions as well. Okay. So we're going to talk a little bit about the arm, right? So we're going to talk about the brachial plexus, and I mean, we talked about the brachial plexus already, but we're going to talk mostly about the arterial supply as well as the musculature, right? Oh, okay, thanks. Okay, so I'm glad it's helpful. Okay, yeah, keep them hard now. Yeah, make them easy for test day. Yep, that's the goal. Facts. All right, so here we're going to have, so basically when on my notes, feel free to like take notes on like this slide. So for example, when he talks about like the biceps brachii, the coracobrachialis, and the brachialis, he's going to have their own slide for it. But I added additional slides, which include complete anatomy images, which I'm going to talk about more so. But feel free to take notes on the slides that like you have right now. But I'll be posting this right after. So we're going to have the brachial artery, right? So we talked about the subclavian artery, which is going to be turning into the axillary artery, right? The axillary artery then turns into the brachial artery. So here we are now. This is the brachial artery, right? This entire thing would be the brachial artery. It's important to note that the brachial artery is going to pass beneath the bicipital aponeurosis, which is super important because, which we'll talk about later, your median cubital vein, which is going to be a vein the vein that you draw blood in when like you go to a phlebotomist and they take blood out. It's going to be from the median cubital vein. It's going to be superior to the bicipital aponeurosis, right? So that's important, like clinically, because if they miss, the odds are they're not going to puncture your axillary artery, right? That's going to be really bad. So that's going to be super important clinically to know. You have branches. You'll have the deep brachial artery, the radial collaterals, the ulnar collaterals, as well as the muscular branches. But I'm going to go into the next slide and a little bit more in detail. But remember, super high yield. I didn't write this down, but remember, deep brachial artery as well as radial nerve are going to go through the spiral groove. Remember, super important. Deep brachial artery and radial nerve are going to run along the spiral groove, which is the posterior aspect of the humerus. That's important. I know that for sure. So I've added a few slides coming from Complete Anatomy in order to like understand these things a little bit more, like the branches. So here's the brachial artery, right? Here's our, we had our vitamin C and D way up here, like you can't even see. Then we had our scrutiloria save a patient, which ends right here, right? And then here's going to be our brachial artery over here. The brachial artery is actually going to branch off into the deep brachial artery, which is right here. This right here is the deep brachial artery. This is why I put arrows here into deep brachial artery, right? Deep brachial artery is going to turn into radial collateral artery as well as radial recurrent. But remember, when they say that the collateral and radial recurrent, in regards to the deep brachial artery, it's the same structure. So for example, over here, think about this like wrapping around right here, because this structure or this like artery is in connection to this right here. It's just going on the posterior side, right? This is considered the deep brachial artery. The deep brachial artery is going to turn into the radial collateral, which is right here. Remember, it's the same structure. It just changes names. Just like how you know, like the subclavian artery turns into the axillary artery. They're the same structure. They just change names, right? This is going to be the radial collateral. Eventually, once you get closer to the elbow joint, I would say from roughly here to here is going to be the radial recurrent artery. And the radial recurrent artery is going to join the radial artery, right, which would be right here. This entire thing is the radial artery. This is why I pointed the arrows here, right? So brachial artery to deep brachial artery to right here, I would say roughly is radial collaterals. And eventually roughly about here would be radial recurrent artery. and then you'll have the radial artery, right? It'll join the radial artery. So the way I remember that is C comes before R, right? So radial collateral comes before radial recurrent. So it's the same thing when we talk about the ulnar on the next one. So for example, you still have the brachial artery coming down. Remember, even though it bifurcates into the deep brachial artery, the radial artery is still going to come down and give off the ulnar collaterals, right? This will be the ulnar collaterals. You don't need to know that this is going to be the same thing. This is the ulnar collateral right here. You don't need to know that there's like a superior and inferior ulnar collateral. That's just too much. Just know that there's ulnar collaterals. This would be an ulnar collateral, which turns into an ulnar recurrent, right? See, this is the same structure, right? But this is just called ulnar recurrent. I didn't point it out, or it's not colored. Like complete anatomy won't even let me color the structure because it's named differently, even though it's an extension of it. This is the ulnar recurrent. Ulnar recurrent is going to join the ulnar artery, which is located over here. It's easier to see right here. This is the ulnar artery, and this is the ulnar recurrent joining right here. So right here, that thing right there, joining into the ulnar artery. So again, it's important to know that the brachial artery bifurcates into the radial and ulnar arteries, right? Because this is the brachial artery coming down, boom, 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 branching off or bifurcating into the radial artery, as well as the ulnar artery. And again, remember the deep brachial artery is going to supply the posterior compartment of the arm. It makes sense, right? It's the only arterial supply, right, that we see here that's going to be supplying the triceps brachii, right? So the deep brachial artery supplies the entire posterior compartment of the arm. And a way to remember that this is going to be the radial artery and this is going to be the ulnar artery is if you stick your thumb up, like you're holding your thumb up basically, and you say like "arr," like basically like you're a pirate. Like the way I remember that is like, oh, that means the radial artery or the radial like bone is thumb side. So basically your radial bone is always going to be on your thumb side. So I always stick my thumb up and you're like "arr," like basically. So it's going to help you remember that the radial bone, or the radius is going to be on your thumb side. So no matter the left arm or the right arm, your radius is always going to be on your thumb side. This is why this is called the radial artery, and this is the ulnar artery. And again, the ulnar, remember the ulnar bone stays in place. The radius is the one that moves. The radius is the one that helps you pronate your hand. So flip your hand over basically. The radius is going to be the one that's going to be doing all the movement. So I hope this little chart right here that I inputted helps a little bit to understand what he's talking about when he says like radial collateral, radial recurrent, as well as ulnar collateral, ulnar recurrent. So these will be on my slides to help you out to remember that. Oh, if you want to remember what like the structures are called, like this pink one, this is the brachial artery. It's highlighted right here, right? Brachial artery. This is called the superior ulnar collateral artery, but you don't need to know the superior. Just know it's ulnar collateral. So that's just a little bit of tips to help you. When does the ulnar recurrent artery become the ulnar artery? Sorry, I missed. Okay, so basically, you have the ulnar collateral, which is coming off of here, right? This is the ulnar collateral, right here, ulnar collateral. This right here, this area right here is the ulnar recurrent. This would be the ulnar recurrent. And then this is going to be dumping into the ulnar artery, which would be located right here. This is the ulnar artery, right? That would be that.
Justin.
Yeah.
So he mentioned in lecture that the area around the elbow forms an anastomosis. Is that synonymous with the collaterals? Like what the anastomosis is that he was mentioning?
Yeah. So when they talk about collaterals and recurrence, yeah, they usually use those names when they're talking about like anastomoses, when things are connecting around like movable joints. Yes.
Okay, but the anastomosis actually doesn't have a name. It would be like this is the ulnar collaterals and the ulnar recurrence.
Yes, exactly. When they say anastomosis, yeah, you're right. Yeah, yeah. When they say anastomosis, they just mean a bunch of things connecting together.
Okay.
Got you. So you have multiple supplies, right? If you flex your arm, you don't want to like lose all the blood supply because you're flexing it, right? So that's why you want to make sure you have it all over the elbow joint. Does that help a little bit?
Yes, thank you.
Got you, man. All right, so this is the same thing he did on this slide, right? I posted it on the last slide, but remember, this is going to be the deep brachial artery. Oh, first of all, this is the brachial artery, right? Brachial artery branches off into the deep brachial artery. And remember, C before R, so you have radial collateral, and then you're going to have radial recurrent, which is I'm like, okay, so radial recurrent is like roughly around here, right? And it's going to join the radial artery. Remember, radial artery is going to be on your thumb side. R, like you said, R is going to be on your thumb side, radial artery. Then you have your ulnar collaterals. Remember, it doesn't matter. You don't need to know that you have a superior and inferior. Just know that you have ulnar collaterals, which are then going to turn into ulnar recurrence. which are then going to join into the ulnar artery, right? Which is going to be located right here. So remember again, posterior compartment muscles is the entire radial, like the radial nerve basically just takes control of all of your posterior compartments. Like when I talked about the Saturday night palsy, like on the quiz, I was like, that's like I said, like when someone's just laying down behind a bar stool and like their arm is behind the chair and they're pinching it basically between the chair. If you pass out there all night, you can actually pinch your radial nerve, and it can actually lead to a radial nerve palsy, an inability to extend any part of your arms, your wrist, your elbows, and your arms. So that would be that. You have the anterior compartment muscles, which would be musculocutaneous, right? We talked about this. This is the really cool nerve, right? This nerve is literally puncturing the coracobrachialis, the coracobrachialis. So, and if you knew that, then you would know that it's going to supply the entire anterior compartment, meaning the musculocutaneous nerve supplies the coracobrachialis, the brachialis, as well as the biceps brachii, right? Remember, when they say antebrachium, they just mean like forearm. Brachium is going to be arm, antebrachium will be forearm. So the pectoralis minor has been removed and revealed these structures below. What is the name of the structure that the black arrow is pointing to? This structure located right here. I know this one's a little tough.
Justin, while we're waiting, when you say compartments, you just mean like that general area?
Yeah. I just mean the entire area. Yep.
Okay, thank you.
Yeah, I got you. Okay, I'll give you a few more seconds to think about that. Okay. Yeah, this one's a little hard. But I mean, yeah, you're right. I'd rather make them hard now so you guys feel like the exam is going to be easy. Okay, so yeah, this is going to be C, lateral thoracic artery. So I threw in some nerves in here just to like mess you guys up a little bit. But just remember, like, this doesn't look like a nerve, right? Remember, nerves look like rubber bands, right? They kind of look like rubber bands. And if I was talking about the musculocutaneous nerve, you would have to be looking at the M, right? Remember, you don't see an M here, right? So if you don't see an M, you're not probably looking at the musculocutaneous nerve. And then the radial nerve will not be here as well because this is going to be the axillary artery, right? So if we know this is the axillary artery, this leads us down to the lateral thoracic artery or the superior thoracic artery. So the black arrow is pointing at a structure, and I'm thinking, okay, so this structure is already distal to this one, so it can't be the superior thoracic artery because the superior thoracic artery is the first branch off the axillary artery. So this would not be the superior thoracic artery. So this would have to be the lateral thoracic supplying the serratus anterior, and this would be the thoracoacromial artery. So I just hit all the little boxes just to show you all. But again, the reason why I said pectoralis minor has been removed is because remember, he said you're going to have 3 parts of the axillary artery, right? The part that's going to be medial, which would be the superior thoracic artery, right? You have the part that's going to be beneath, which is what is showing right now, the thoracoacromial artery, as well as the lateral thoracic, which would be the lower. And you have the third part, which is going to be lateral to the pectoralis minor, which would be save a patient, which is basically going to be subscapular artery, as well as anterior and posterior circumflex femoral. So this right here, I wish I can put like a bigger star. Like I wish I can make a star that's as big as this page, because this is like, I think, extremely high. Well, actually I know this is going to be extremely high yield. I would know like everything on this slide, like to the T. I'm not even kidding. Because this is going to be testable material. And he can definitely test like on anything in regards to like what's going on with this innervation for cutaneous innervation. So I'll give you like an example question. Like, let's just say like, he's like, okay, so a patient is, for example, lost sensation in the distal phalange on the posterior side of his on the posterior side of his hand. What cutaneous innervation is going to be the one that is deficient? So you would have to like remember this, like for example, this chart, and remember that the distal phalange, for example, well, he would have to be specific. So the distal phalange of the second metacarpal would be the median nerve, right? The second or the third would be the median nerve if you're talking about the posterior side, right? Which would be located right here, distal phalange, right? Because your phalanges are your fingers, right? You have like 3 parts. You have a proximal phalange, a middle, and then a distal phalange, right? That's why you can bend your fingers like that, right? Because you have like 2 different lines that break up your fingers into like 3 different spots, right? So that would be like the median nerve, for example. But he can be super specific, like we said. This is why I don't want you guys to get caught off guard on this question, because I know I was. So you got to make sure you understand something like this along the line. So this would be, I think this is pretty high yield. Okay, so you have brachial artery and musculocutaneous nerve, right? That's going to be I think the highest of yield in regards to the anterior arm, right? This is going to be the highest of yields because you're going to have brachial artery, which is going to be on the anterior side, and musculocutaneous nerve, which is also going to be on the anterior side. So I just summarized what he posted here just on these 2 little blocks, right? The posterior side is going to be the deep brachial artery, which we talked about. We talked about the branches of that. And you also have the radial nerve. Remember, the radial nerve is going to be innervating the entire posterior side of your arm. That's going to be a radial nerve. And I would note the intermuscular septum as well. I think it's good to know that this is going to separate the anterior compartment of the muscles from the posterior compartment. So here's a little section summary. I wrote just to like put it all together, like this slide, but just putting it in very simple terms. This is going to be the anterior arm, right? For example, the anterior arm, which is the front part of the arm, you have brachial artery as well as musculocutaneous nerve, right? So look at this. This is the coracobrachialis. Look at the musculocutaneous nerve literally stabbing right through the coracobrachialis, puncturing right through. That's going to be the musculocutaneous nerve. That's also going to innervate the biceps brachii as well as the brachialis. This is why it says the musculocutaneous nerve innervates the entire anterior arm. The posterior arm is going to be supplied by the deep brachial artery as well as the radial nerve. There's nothing too much to talk about on this slide, I would say. I would just say that you just know that the cephalic vein is going to drain the lateral side of the arm, while the basilic vein is going to drain the medial side of the arm. I think that's pretty important. So which nerve supplies the latissimus dorsi? We're almost done here now. A, B, C, or D? Did somebody say something? Okay, so the nerve supply for the latissimus dorsi is going to be B, the middle subscapular nerve. Remember, the middle subscapular nerve is the same thing as the thoracodorsal nerve. It's just, it can be used interchangeably. So I wanted you all to realize that the middle subscapular nerve is the same exact thing as the thoracodorsal nerve. So I put it in your notes and I asked you a question on it just in case he put that on an exam. I know it's not the highest of yield, but I think it's important to note that those both mean the same thing. And if he does put that in an exam, the last thing you want to do is get it wrong because you didn't know the interchangeable word, right? The upper subscapular and the lower subscapular are going to supply, remember, the subscapularis, while the lower subscapular is going to supply the teres major, right? The suprascapular nerve is going to supply the supraspinatus as well as the infraspinatus. So again, we're just going to go through these probably relatively quickly, so that we'll go through all the anterior compartment as well as some of the posterior. So here's the slide that you all have. I'm going to show you the next slide, which is just a copy and paste of everything that he wrote here, but with a little bit, I guess I would say, clearer images. So I broke everything up into their compartments. So what I mean by that, so he talks about the biceps brachii, the coracobrachialis, the brachialis, as well as the triceps. And I compartmentalized each one into its own slide, basically. So I gave each slide its own cadaver pictures. So I grabbed all the pictures that are associated with that muscle, and I put it on its own slide. And I also added a complete anatomy images in order to like give you like one spot to look at this, so you don't have to like go like all over the place looking for where the biceps is or which one looks like the biceps. So here's the proximal attachment, right? You're gonna have the long head is going to attach to the supraglenoid tubercle, right? So I'll start here. This is gonna be the long head of the biceps brachii, right? The long head of the biceps brachii is going to attach to the supraglenoid tubercle, right? So the supraglenoid tubercle of the scapula. So that's pretty important because that's what makes the biceps brachii a two-joint muscle, right? As well as the short head. The short head is going to attach to the coracoid process, as you can see right here, right? This is the supraglenoid tubercle, which is why I put a picture here just in case it was hard to see it. This is the supraglenoid tubercle. This is the glenoid fossa, and this would be the infraglenoid tubercle. So again, this is the scapula. This is going to be right here. So this is why this is the supraglenoid tubercle, right? It's the same thing over here, right? So long head, which is right here of the biceps brachii, here's the tendon, right? Obviously, you can't see where the tendon goes because this is going to be in a cadaver, but I'm showing you here where it actually goes. It's going to be in the supraglenoid tubercle, which is over here on the scapula. The short head is going to go to the coracoid process, right? You can't see it here, but that's why I inputted this image to make it very clear that the short head goes to the coracoid process. And then you're going to have the distal attachment. The distal attachment, the bicipital tendon is going to attach to the radial tuberosity, right? So this is the biceps brachii, right? The reason why I know that is because it has the bicipital aponeuroses, right? Which is this thing right here. This bicipital aponeuroses is going to like obviously come off of the biceps brachii. So that's how I know this muscle that the black arrow is pointing to is the biceps brachii, right? And then it's going to attach to the radial tuberosity, which is just a point on the radius, right? That's all that means basically. And yep, this is the bicipital aponeurosis. So here's the biceps brachii. It's two pictures that I found that are going to be located for the biceps brachii on cadaver pictures, as well as its complete anatomy pictures to get you to understand where exactly this is going to be on a virtual image. So here's the coracobrachialis and the brachialis. So I'm going to talk about the coracobrachialis. So I did realize after I made my notes that he does have images of the coracobrachialis on cadavers. I just didn't find it for some reason. I'm going to try and add them before I send it to you all and put it on this slide so you can like look at everything at once. But this is going to be the coracobrachialis. So you can see, look, it's attaching to the coracoid process of the scapula, right? And its distal attachment will be the medial shaft of the humerus. So if you look at these pictures, I mean, long enough, like I think about the coracobrachialis, and if you think about this image, like it's pretty clear that you can see that it's going to be the coracoid process as well as the medial shaft of the humerus, right? On a cadaver, it won't be as simple or it won't be as easy to look at, but I'm going to see if I can get those pictures on here because I couldn't find them before, but I'll get them on there. But remember, super important, coracoid process. Brachialis, which is going to be over here, this is going to be the brachialis, right? So he put a picture over here, which is going to be associated with flexing of the arm, right? This would be the brachialis. This is the brachialis in a complete anatomy image. Remember, the brachialis attaches to the proximal, or the mid shaft of the anterior humerus, which is located right here. Its distal attachment is the coronoid process of the ulna. Super high yield because coronoid sounds exactly like coracoid. So obviously that's going to be tricking up a lot of people if you don't know the difference between coronoid and coracoid. So that is definitely, I put that in red. So the brachialis is going to attach to the coronoid process of the ulna, right? It's going to attach to the ulna. So here's the brachialis. It's going to come from the mid shaft of the humerus, which is the same thing. This is the same thing as that, right? The mid shaft anterior surface of the humerus, and it's going to attach to the coronoid process of the ulna, which is located right here. Same thing right here. So I give you like two images so you can compare them.
Is that superficial or deep to the biceps brachialis?
So both the coracobrachialis as well as the brachialis are deep to the biceps brachii.
Thank you.
Yeah. Yeah, so the coracobrachialis would be just like this, and the biceps brachii would be just like how we showed here. And and the brachialis would be like this, and the biceps brachii would be covering this entire thing because it's huge. Yes. Okay, so he put all these pictures here, but like as I told you, I like copied and pasted them onto like the perspective slides. The only one I didn't talk about was the brachioradialis, and that's just because he didn't talk about it much during the lecture, and we'll talk more about that when we get into the RM lectures this upcoming week. So you'll definitely be seeing a lot more images of the brachioradialis, but I did input this one, and this one as well.
Justin, real quick, sorry. The biceps brachii is the long head is lateral to the short head?
Yes.
Okay, I just wanted to make sure. Thank you.
Gotcha, yeah. Oh, and another thing to note, you all, is that, remember, yes, like I said, the biceps brachii, which is located here, this is the short head of the biceps brachii. It's covering the coracobrachialis because the short head of the biceps brachii attaches to the coracoid process as well as the coracobrachialis. So like you said, you can't see the coracobrachialis because it's deep to that. And you can't see the brachialis too much because it's deep over here. So yeah, just wanted to note that. So here's the triceps. So I just copied and pasted what he wrote here onto another slide just to make it a little bit more clear. Also, another thing to note, there's a star here. I don't even think I put that star. I think that's his star. Is to know what goes through the quadrangular space. Remember, only AP students can pass through the quadrangular space, axillary nerve, as well as posterior circumflex humeral artery, right? As well as posterior circumflex humeral artery. Over here, also really important to note, is that the radial nerve as well as the deep brachial artery are going to pass through the spiral groove, right? Super important again. Okay, so here's the images, the complete anatomy images, as well as the muscles, basically, as well as the cadaveric images, right? So you have the proximal attachment. This is going to be the long head. We have a long head, a lateral head, as well as a medial head. This is going to be the long head. The long head of the triceps brachii is going to attach to the infraglenoid tubercle, right? Which is right here, right? It's going to be right here, the lower part of the glenoid fossa. So this is going to be the long head of the triceps brachii, infraglenoid tubercle. And you're going to have the lateral head, which is going to be posterior to the humerus. It's going to be superior to the spiral groove. What's going to be running through the spiral groove? Do you all remember? Somebody can just shout it out. Spiral groove.
Is it the radial nerve and the brachial artery?
Deep brachial artery.
Brachial artery.
Yeah, good. But no, really good. Yes, that is correct. So again, that's basically that's where this is going to be located, right? So the lateral head is going to be superior to that, superior to the spiral groove. Then you have the medial head, which is very hard to see because these two are like are basically covering it. This is technically the medial head right here, if you can see that. This little thing right here. This is the medial head. And that's actually going to be attaching inferior to the spiral groove. So again, lateral head, superior to spiral groove, medial head, inferior to spiral groove. And again, I attached the cadaveric image as well to help you all out. This is, like we said, we'll have the long head, the lateral head, as well as the medial, which is very hard to see, but I would assume it's going to be somewhere around here. But what's more important, like we said, to note, I put it right here. The deep brachial artery and the radial nerve are going to run through the spiral groove. Super, super, super important. So here are the extensors of the muscle. So I just said to note the anconeus as well. Just note that the anconeus is also an extensor. He didn't talk too much about it, but just know that's going to help with extension of the arm as well. So the triceps brachii, as well as the anconeus, which is like this triangle thing on your elbow, is going to also help with extension of the elbow. So which muscle is the black arrow pointing at? Oh, right. So it's going to be A. Yes, the short head of the biceps brachii, which would be right here. Short head of the biceps brachii attaching to the coracoid process. So yes, really good. You all got that right. It's going to be A, short head. Yes. So I guess the most important thing on this slide, we already talked about this earlier, but that the median cubital vein is going to be superior to this bicipital aponeuroses, right? So it's going to allow for you to draw blood without causing damage to the axillary artery, right? Another thing I think important to note is that the cephalic vein is going to be on the lateral side of the arm, so it drains the lateral side of the arm, while the basilic vein is going to drain the medial side of the arm. So I think that's pretty important to note as well in regards to veins. So again, cephalic vein, lateral, basilic vein, which is going to be medial. So this will be the basilic vein, this will be the cephalic vein. Again, I feel like you can use this as well. Feel free to use this to like test yourself and practice. So the last few slides, so this is just basically going to talk about flexion and extension at the different joints. So for humeral ulnar, that just means from the humerus to the ulna, right? So you have flexion and extension. So what connects to the humerus and the ulnar for flexion is going to be the brachialis. The brachialis is going to attach from the humerus to the ulnar, as you can see right here. It's going to be attached to the ulnar right here. So it's going to help with flexion for the humerus to the ulnar joint, right? For extension of the humerus to the ulnar, we know that the triceps brachii is going to attach to the olecranon process of the ulnar, right? So it's going to help with extension. You also have the anconeus, which is why I put the image right here, which is going to attach from the humerus to the ulna, and it's actually going to help with extension of the elbow, if you can see that, right? So that's why I added these here. So for the humeral radial, that's going to be anything that's going to be attaching from the humerus to the radius, right? So for flexion, that would be the biceps brachii, right? Because remember, the biceps brachii is going to be attaching to the radial tuberosity, right? So to the radius, and it's going to provide flexion. For extension, there actually I didn't find any muscles that were helping with extension of the radius to the humerus. I feel like just because due to the fact that the triceps brachii does a huge amount, almost all of the extension of the arm, and it's going to be attached to the ulnar because the ulnar is a stable structure, right? Because the radius is the one that's going to move over the ulnar when you pronate your hand. So it makes sense that the triceps brachii attaches to the olecranon process of the ulnar. So we answered, one more, and then the proximal radial ulnar, so rotation. So when we talk about supination, it's pretty cool because we have a muscle that's actually called supinator. So that helps us remember it. This would be the supinator right here, located right here. And it actually helps with supination of your hand, right? So when he says proximal radial ulnar, that's going to be a supinator. That's going to allow us for supination. So we answered all these questions except for are any of these muscles two joint muscles? Yes, the biceps brachii, both heads, right? Because the long head of the biceps brachii attaches to the supraglenoid tubercle of the scapula, which means it crosses the shoulder joint as well as the elbow joint. The short head of the biceps brachii is also going to cross the shoulder joint because it attaches to the coracoid process of the scapula, and it's also going to attach to the radial tuberosity, which is past the elbow joint, right? So the biceps brachii in general is going to be a two joint muscle. The long head of the triceps brachii is going to be the only two joint muscle that's going to be a part of the triceps brachii, because the long head is going to attach to the infraglenoid tubercle of the scapula, right? So that means it crosses the shoulder joint as well as the elbow joint. The lateral and the medial heads are only going to start at the humerus, meaning that it only crosses the elbow joint, right? So those won't be two joint muscles. The only one that would be a two joint muscle would be the long head of the triceps brachii. So again, super high yield right here. I would know this. I would study this as much as you can. I would study this a little bit as well, but I think this one's a little bit more important. But yeah, same thing with here. Again, I have one more question and then we're done. So what is the innervation of the muscle pointed at by the arrow below? The movement of the coracobrachialis is going to be to flex the shoulder because it's going to be connected from the coracoid process of the scapula to the humerus. So it's actually going to help with flexing the shoulder. Got you. All right, last one. So what is the innervation of the muscle pointed at by the arrow below? So this is going to be the anconeus, yes. This is the brachioradialis, but we'll talk about that later. So the answer is going to be C, radial nerve. So remember, the extensor compartment of the arm is going to be the triceps brachii, but don't forget the anconeus as well. Anconeus will be innervated by the radial nerve, so will the triceps brachii as well. Yep, and that's going to be it for me. So sorry I went a little bit over time. It was a lot of information to go through. I hope that helped a little bit, but I'll stay if you guys need me for a little bit more questions, but feel free to head out. I know this is a very long day. Yeah. Thanks again, you all. I'll stay for a little bit if you guys have questions.
Justin, I have a question.
Yeah.
Could you go back to, I think it's slide 13 or 14. It's one of the ones where you pointed out the axillary nerve, but I just wasn't sure exactly which one it was.
So was this on the last lecture, right?
Mm-hmm.
Am I still sharing my slide?
Yeah, we can see them, but they're not big. We can see all the ones on the side too.
Oh, okay. So let me know when I pass it. Is it, you said axillary nerve?
Yeah, it was like towards the beginning.
Oh, it's toward the beginning. Okay, let me scroll all the way up. Hold on. Oh, was it off a cadaver picture?
Yeah, it was one of
Okay.
the ones we had 3 on the same page, I think.
Okay, over here.
Not that one.
Okay, let me see.
It's I think it's 19 on yours.
So this one?
Mm-hmm. Yeah, so the left picture.
Okay. So what was your question?
Just which one's the axillary nerve? Like I just looked in the.
This one is.
Okay.
Oh wait, do you see my arrow? My bad. Do you?
Yeah, I can see your pointer.
Oh, okay, yeah. Because sometimes you can't see the pointer, but yeah, this is going to be the axillary nerve.
Okay, thank you.
Does that help?
Mhm.
Okay.
Justin,
Yeah.
can you go over the dermatome slide? I'm sorry, but I get a little confused with the dermatomes and like what do I need to be taken away from that slide? Or can you walk me through that slide, please? The dermatomes
Yeah.
and the
Yeah.
brachial, please.
Are you talking about this one right here?
Either that one or the one that comes before it.
Okay, so
I think they're both basically saying the same thing.
yeah. Hold on, wait. Let me see if I find them. This one, eh?
Mm-hmm.
Okay. Okay, so yeah, so you want me to go over what you should know. So I feel like what you should know is going to be like where the general areas are for each corresponding nerve. So for example, this gray area is going to be the axillary nerve. So I mean, it's going to be a little difficult for him to distinguish between like a deficit in what area is going to be contributed by like axillary nerve or radial nerve, because like this line is kind of arbitrary, like, you know what I mean? But it's just important to know that the axillary nerve and the radial nerve are going to supply the cutaneous innervation of the posterior compartment of the arm, right? So for example, if he's like, oh, there's a deficit and someone feels numbness on the posterior side of their arm, you have to already think it's either going to be axillary nerve or a radial nerve, for example. He most likely won't talk about medial brachial cutaneous nerve, but I would still note that just in case. You see what I'm saying?
Yes, and then can you go forward to the other dermatome slide?
Yeah. Okay.
Okay, that's the same thing. All right.
Yeah, I know it's a little confusing, but you just have to remember like what these stand. So for example, like lateral antebrachial cutaneous, it literally has it in its name. The lateral side of the antebrachium, which is going to be the forearm, right? This is the lateral side of the forearm. This is median antebrachial cutaneous, so the medial side of the forearm, right? This is going to be medial brachial cutaneous, which means the medial side of the arm, which is right here. Does that help a little bit to like memorizing most of these?
Yes, it does. And
Yes.
then so on the slide next, or the picture next to it, where it's showing the dermatomes of the upper limb. So if you have, let's say, tingling, in your upper pectoral area, are you thinking like it's T1 or C5?
So I don't think he'll go to that area because that might be a little more like ambiguous, right? So I would say if you did learn this one, I would say mostly like C7, right? So like that's going to be a good question. I feel like knowing C6 is the thumb and C7 is going to be the index in the middle, and then C8 is going to be ring and pinky.
Okay. Thank you.
Gotcha. Yeah. Okay. Any more questions? Oh yeah, go Heat, by the way. Okay. All right, so if you guys don't have any more questions, oh wait. Wait, Andrew, are you still there? Do you want me to answer that question about pointing out the upper and lower subscapular? Okay, never mind. Okay, thank you all. Have a great night. Yeah, take it easy. Enjoy your weekend, okay?